I request all of you to please take your seats. Thank you.
Pandemic has proved that skills go beyond education, jobs go beyond degree, and college goes beyond infrastructure. But the catch is having everything in between the two extremes. At Noble University, we are striving to achieve just that. The absence of educational institutes in Surat region for higher studies resulted in migration of a lot of talent from Junagadh and surrounding regions to bigger cities of Gujarat. While there is nothing wrong with this, some students were not able to afford staying away from home or higher fees. We took it up as our duty to bridge this gap by starting Noble Group of Institutions in the year 2007, thus becoming the pioneer of quality higher education in Junagadh region. There was no looking back once we embarked on this journey of learning. We are now a family of 22 colleges spanned across 59 disciplines matching the global trends. Noble University is shaping the future of more than 5,000 students each year. Students have a free hand in selecting courses and can hone their skills in our professional programs like medical, paramedical, pharmacy, engineering, nursing, management, and commerce and science. Commuting facilities to nearby regions has resulted in reduced college dropouts rates and helped in developing industry-ready skills among students belonging to villages where earlier getting a degree was a dream away. We understand the need to be closer of nature for uplifting learning spirits and campus that is spread across 35 acres with over 4 lakh square feet of infrastructure, meeting the standard requirements for technology-driven classrooms, labs, workshops, field area, offers the wide expanses of mystic Girnar ranges. This has helped us in instilling humbleness, kindness, and humanness in our students. To ensure that our students don't have to search for boarding facilities, we provide a home away from home within the campus. Our executive hostel accommodates more than 2,000 girls and boys who enjoy facilities like hygienic food, gym, and a well maintained sports complex. Our skilled focused education format is driven by 21 computer labs consisting of 1,000 plus highly configured system to make sure that students stay current. We believe in the power of reading that can shape young mind and thus our library is home to 85,000 plus books. Our motto is to train a generation that is future ready. Our events like Endeavor, Sportsmania, Project Fair, Job Fair, festival celebrations, etc., are ideated, designed, undertaken, and coordinated by students. Such events and activities help in developing their soft skills. We believe in giving back to the society, and our medical and paramedical students organize free healthcare camps within our campus hospital, wherein Ayurvedic and homeopathic approaches are used to treat patients. Teachers are as much a part of a learning process as are our students. To keep everyone motivated, we provide an atmosphere that is led by innovations. We organize national and international level conferences wherein we invite experts from multiple disciplines to share their knowledge with our faculties and students. We feel honored to share that we organize regular workshops given by ISRO's current chairman. At Noble University, we maintain that it is crucial to have a culture exchange with the world to understand the global diaspora. To fulfill this, we encourage our students to take part in the student exchange program, wherein selected students from technical fields go abroad to study for one semester. Such an exposure helps in shaping our students as a tolerant populace who know their way around the world. We know that not all students come from an affluent background. To facilitate education for all, we have generous givers who make it possible for us to welcome every student irrespective of their background. The scholarships given to high performing and financially weak students help in boosting the overall morale of the university. The internet And now the pandemic has changed the dynamics of education and professional work. To make our students prepared for anything that comes in their way, we have partnered with more than 150 industries across multiple sectors. Such collaboration have brought us good outcomes in the form of increased job opportunities. The team at Noble University are dreamers. We have the fire to produce consistent fuel for moving towards all the tomorrows, for taking education and our students to unimaginable heights. We are breaking stereotypes with the way we move forward to adapt to the global changes. Our visions are traveling at the speed of light, and we are confident to take our students in the spaceship called growth towards the future. Noble University, Global Vision.
A very warm welcome on behalf of Noble University. I request Professor Binu Joy sir and Himanshu sir to escort all the distinguished guests on the dais as we are about to start the program. Ladies and gentlemen, esteemed healthcare professionals, and distinguished guests, a very warm and beautiful morning to all of you. Welcome you to the National Conference on Futuristic Approaches in Nursing Practice. As we gather here today, we embark on a journey towards innovation, excellence, and transformation in nursing. Our theme, Futuristic Approaches, encapsulates the spirit of progress, adaptation, and anticipation of what lies ahead. Nursing as a profession is at the forefront of patient care, research, and advocacy. In this dynamic landscape, we recognize the need to embrace forward thinking strategies that empower nurses to thrive in an ever evolving healthcare system. I am Deepika Tang, Associate Professor at Vibrant Nursing College. It's with great honor I stand here today, surrounded by passionate individuals who share commitment in advancing nursing practice. Joining me is my esteemed co host, Anjana Ganvit, a dedicated nursing tutor from the same college. Together, we aim to create an engaging and insightful experience during this conference.
Let's embark Let's embark on this journey of exploration, learning, and collaboration as we delve into futuristic approaches in nursing practice. May our collective efforts contribute to a brighter and more compassionate healthcare landscape. Thank you for being part of this remarkable gathering. Let me provide you with an introduction to Noble University, a beacon of excellence in nursing education. Established in 2011, Noble Nursing College has been trailblazer in shaping the future of nursing professionals, recognized by both the Indian Nursing Council and State Nursing Council. This institution stands as a testament to quality education and compassionate care. The courses offered are A&M, GNM, Basic Nursing, and Post Basic BSc Nursing.
The National Teachers Association India is a dynamic platform that enriches the nursing knowledge of trained nursing personnel. Its vision is to create growth and impact in all aspects of nursing education worldwide. In the world where the population ages, where families evolve, and where healthcare system demands a surge, caregivers play an indispensable role. They are the silent heroes, the ones who hold hands, listens, and heal. That is where the National Nursing Scholar Society was established with the motto of care of the caregivers.
Commencing an event with the lighting of the lamp sets a positive tone. It signifies auspicious beginnings, blessings, and good fortune. Lighting the lamp fosters a sense of community, shared purpose, and collective strength. The lamp, when kindled, represents the dispelling of darkness. It is a metaphor for knowledge, wisdom, and enlightenment. I invite all the respected dignitaries to come forward and kindle the lamp, and may it illuminate our path and guide our endeavors. I invite the students of Noble Nursing College to come forward and sing a prayer song to offer our gratitude for wisdom. Let's bow our heads and fold our hands.
हे हंसवाहिनी ज्ञानदायिनि अम्ब विमलमति दे। हे हंसवाहिनी ज्ञानदायिनि अम्ब विमलमति दे। जग सिर मोर बनाए भारत वे बल विक्रम दे। हे हंस वाहिनी ज्ञानदायिनि अम्ब विमलमति दे। साहस शील हृदय में भर दे, जीवन त्याग तपोमय कर दे। साहस शील हृदय में भर दे, जीवन त्याग तपोमय कर दे। संयम सत्य स्नेह का वर दे, स्वाभिमान भर दे। हे हंस वाहिनी ज्ञानदायिनि अम्ब विमलमति दे। नव कुश ध्रुव प्रहलाद बने हम, मानवता का त्रास हरे हम। लव कुश ध्रुव प्रहलाद बने हम, मानवता का त्रास हरे हम। सीता सावित्री दुर्गा माँ फिर घर घर भर दे। हे हंस वाहिनी ज्ञानदायिनि अम्ब विमलमति दे। अम्ब विमलमति दे। अम्ब विमलमति दे।
Together, we compose a masterpiece, a mosaic of cultures, profession, and aspirations. Let us celebrate our diversity, for it is the palette that colors our conversations. To begin with, allow me to extend a warm welcome to our distinguished chief guest, Dr. Pragna Dabi, the Registrar of Gujarat Nursing Council. Her tireless dedication of nursing education and practice has left an undeniable mark on our profession. Dr. Dabi, your presence today here inspires us. As we gather to explore the futuristic approaches in nursing, we eagerly await your insight and wisdom. I invite Professor Bipin, Director, Noble Nursing College and President of NSS Junagadh chapter, to come forward and extend a warm welcome to Dr. Pragna Dabi ma'am with a bunch of flowers. We welcome you, ma'am.
Allow me to extend a warm welcome to our distinguished Vice President of the Gujarat Nursing Council, Mr. I.A. Kadiwala. His leadership and commitment to nursing education and practice have been instrumental in shaping our profession. Mr. Kadiwala, your presence here today inspires us. I call upon Dr. Jitendra Jindal, sir, Principal, Noble Nursing College, to come forward and extend a warm welcome to sir, Mr. I.L. Kadiwala, sir. Welcome you, sir.
It is with great honor that we extend a warm welcome to Shri Nilesh Bhai Dulesia, the President of Noble University. We welcome his presence. Sir is not present in the meeting today.
With utmost reverence, we extend our heartfelt welcome to Mr. Girish Bhai Kotecha, sir, the President of Nobel University. Welcome you, sir. With profound respect, we extend our warmest welcome to Mr. V.P. Trivedi, sir, the Managing Trustee of Nobel University. His arrival bestows upon us tapestry of sagacity and intention. I humbly invite Mr. Ankit, Assistant Professor, Nobel Nursing College, to extend a warm welcome with flowers. Welcome you, sir.
We extend our warmest welcome to Mr. K.D. Pandya, sir, the co-managing trustee of Nobel University, whose leadership resonates like a timeless melody, a symphony composed of foresight and unwavering commitment. To do the honors, I invite Mr. Rikin, sir, Principal, Government Nursing College, Junagadh, to come forward and extend a warm welcome on behalf of Nobel University.
With great honor and immense pride, let us welcome Dr. Ejan Kher, sir, Provost, Nobel University. To do the honors, I welcome Ms. Nidhi Keshwala, Assistant Professor of Nobel Nursing College, to extend a warm welcome to sir. Welcome you, sir. With open hearts, we extend a warmest welcome to Professor Dr. Farooq Khan, sir, National Nursing Teachers Association of India President. I invite Ms. Nidhi Hirpara, Nursing Tutor of Nobel Nursing College, to extend a warm welcome to sir. Welcome you, sir.
Our next personality needs no introduction. He is the man with determination, dedication, and discipline. With immense pride, let us take this opportunity to welcome Professor Dr. Binu Joy, sir, National NSS President and Principal at Murlidhar College of Nursing, Rajkot. I invite Ms. Ashima to do the honors and welcome sir with a bunch of flowers. We welcome you, sir. We take this opportunity to welcome Mr. Ronak Hussain, Registrar, Nobel University. To welcome sir, I invite Mr. Bipin sir to come forward and extend a warm welcome.
We extend a warm welcome to Mr. Bipin Pandya, sir, President, NSS Queens Chapter and Director of Nobel Nursing College. I humbly invite Ms. Geeta Pansara, Nursing Tutor of Nobel Nursing College, to extend a warm welcome to sir. Welcome you, sir. We extend a hearty welcome to Professor Rajesh Kumar, sir, Principal of Government Nursing College, Junagadh, and he is today GNC Observer for conference. I invite Ms. Monica to extend warm welcome to sir. Welcome you, sir.
Let me take this opportunity to welcome Professor Himanshu Trivedi, sir, Principal, Panchamrat College of Nursing. To do the honors, I invite Ms. Jane, Nursing Tutor, Noble Nursing College, to extend a warm welcome to sir. I invite Mr. Dakshish, sir, to please extend a warm welcome to sir. Welcome, sir. With profound respect and immense gratitude, we extend a warmest welcome to Professor Dr. Alka Tajane, Secretary General, National Nursing Scholar Society and Principal at Vibrant Nursing College, Surat. I invite Ms. Madhvi, Nursing Tutor, Noble Nursing College, to extend a warm welcome to Madam. We welcome you, ma'am. Now I invite Mr. Dakshish Patel, sir, to give a floral welcome to Mr. Himdeep Patel, Joint Secretary at TNAI Gujarat. Sir is also the Yuva Mantri of Bajpa, Bharuch district. We extend a warm welcome to sir. I also extend my warm welcome to Mr. Mansukh Bhai Dhaduk, Trustee, Balaji College of Nursing. For that, I invite Himanshu sir to extend a warm welcome.
Now it's time to extend welcome the stars of this conference. All delegates who have traveled all the way to attend this conference and make its resounding success. So heartily welcome to all. May this gathering be a chapter in your story, a chapter with laughter, learning, and lasting connections.
I also like to extend a warm welcome to Mr. Manish sir, who's the President Secretary at NTAI. I invite Mr. Himanshu sir to come forward and welcome sir. We would also extend a warm welcome to Madam Falguni, who is the President at NTAI. I request Jindal sir to come forward and extend a warm welcome to Professor Falguni ma'am. Moving forward, we would like to hear a few words of encouragement and insight from our distinguished guest. For that, firstly, I would like to invite Dr. Binu Joy sir to come forward and speak a few words. Sorry. We would like to also welcome Mr. Ambubai Pokia, Trustee, Mahatma Gandhi Nursing College. For that, we would invite Jindal sir to forward a warm welcome. Welcome, sir.
Respected guests on the dais and off the dais, a warm welcome and warm good morning and namaste to one and all. Really, it's an immense pleasure and beautiful to address this beautiful August gathering with lots of smiling faces spreading across this arena. Yes, this noble university, Noble Nursing College, Junagadh, in collaboration with the Nursing Teachers Association of India, Gujarat branch, and the Nursing Scholar Society, Quincy chapter, Junagadh. It's really very happy moment that we have our Gujarat Nursing Council Registrar, Dr. Pragnaben Dhabi, as our chief guest for today's conference. We are really bestowed with her blessings, and it's always blessings to hear from her. Her knowledge and expertise in the field is always exemplary. Also, it's a great time to cherish in the midst of us. We have our guest of honor, Sri Iqbal Kadiwala sir, Vice President of Gujarat Nursing Council, the young, dynamic fraternity of the nursing in Gujarat, a legend in his own styles and ideas. He is really available for all of us 7 into 24. Sir supports gives us this conference a really great success. We are extremely thankful to you, sir. Thank you. The support of Noble University, especially the President, Shri Nilesh Bhai Dhulesia, Noble University, Shri Girish Bhai Kotecha, Vice President, Noble University, Shri VP Trivedi, Managing Trustee, Shri KP Pandya, Co-Managing Trustee, Noble University, Dr. H.N. Kair, sir, Provost, Noble University, along with other trustees of Noble University, your support is immeasurable. Without you, we would have been not. Your esteem, this arena and a campus made this event very beautiful. I'm thankful to all of you. The individual success and great talents and skills can bring only individual medals, but the team success and a teamwork leads to the great success of the whole team and organization. The stone started rolling for this conference with the hard work of the organizing committee under the esteemed leadership of Mr. Vipin Pandis. His energy is really remarkable, a renowned person, and truly, I am really very his has yes. Your hands of applause surely shows that he's really a godfather of the nursing. His support and his word that is really very. We esteemly tell whenever we meet, sir, you are godfather of nursing, extremely a support in nursing and specifically in Junagadh. And sir has really made us this conference support. He takes the team together just and makes it a very great success. Thank you, sir. On behalf of the Nursing Teachers Association of India, the Nursing Scholar Society, and the Noble University, I take this opportunity to welcome you all to this conference. And I'm very thankful to the esteemed resource persons, speakers, and all the who have come to share, accepted our invitation, and we will be very enlightened to hear from you in the forward sections. Thank you all the speakers and moderators for accepting our invitation. I assure you, all the delegates, that this conference will help you to explore yourself and update the future both in the education and the research process. In order to empower ourselves with an eye towards the future, the delegate can acquire the academic informations and skills which is very necessary to flourish your own creativity and innovative abilities. So I welcome you all a pleasant stay in this beautiful campus of Noble University. Thank you all for coming such a large numbers. We are really extremely thankful to you all because without you all, it had been delivered. So extreme thankful for coming in such a large number. Thank you. Namaste.
Thank you so much, sir, for the encouraging words. I would like to invite Mr. Dakshish Patel, sir, to come forward and felicitate Dr. Binu Joy, sir. Now I invite Dr. Farooq Sir, President NTAI, to come forward and speak a few words to the audience. Over to you, sir.
Good morning, ladies and gentlemen. Today is a huge day as Novel University, Novel College of Nursing is organizing such a national conference in Junagadh. It's immense pleasure that I have come here to attend this conference. And this is happening because the support of Novel University. And we can see today's chief guest, Florence Nursing Nightingale awardee, Professor Dr. Pragna Davi ma'am is here. Registrar, Gujarat Nursing Council, and Vice President of Gujarat Nursing Council, Professor I.A. Kadiwala sir, is present here. And some our esteemed trustee members, somehow they are busy in their busy schedule, but their support we can see here. They have cooperated us, they are supported to organize such a national conference. Sri Nilesh Bhai Duledia, President, Novel University, Vice President Sri Girish Bhai Kotecha, Managing Trustee BP Trivedi sir, Co-Managing Trustee KD Pandya sir, Pro-Host Dr. H.N. Khair sir, and other esteemed trustee members, Mr. Parth Dulesia, Associate President, Associate Vice President, Mr. Parth Kotecha, Associate Managing Trustee, Mr. Manish Trivedi sir, Associate Co-Managing Trustee, Mr. Siddharth sir, Siddharth K. Pandya sir. Next, our advisory committee members. Professor Emirate Dr. S. Narula Khanna, patron of NSS or NTI, who always support our NSS as well as the NTI. Professor Dr. Bimla Kapoor ma'am, Professor Binu Joy sir, Professor Dr. Manish Kumar sir, Professor Dr. Alka Tanje, Professor Dr. Anu Joy, Professor Dr. Poonam Thakur, and all respected organizing committee members, especially Sri Bipin Pandya sir, Professor Himanshu sir, Mr. Dakshish Patel, Professor Faguni Madam, Mrs. Himali Prajapati, Mrs. Stuti Makwan, Dr. Abhinav Bhatt sir, and all the esteemed speakers and chairpersons of today's session. Faculty member of various nursing institutions who have come here to attend this conference, and the participants who are participating this conference online as well as offline who are present here. So it's an honor to announce that first national conference on futuristic approach toward nursing practice in hybrid mode is being organized by Novel University, Novel College of Nursing in collaboration with the Nursing Teacher Association and NSS, Gujarat branch, Gujarat chapter. So futuristic means what? Futuristic nursing. We can say that using the latest science and technology to improve patient quality care, quality of life from birth to end of the life.
Hello.
A clinical education, as we see nowadays, due to the research, we are implementing so many trends in nursing, like simulation, we can say. INC also is providing the free training to the educators of simulator training. So day by day, the new trends is applying in nursing. And this is a need to make the curriculum based on futuristic approach. Advanced clinical education is one of the signature pedagogies in the discipline of nursing. If we see globally, the demands of the nursing workforce and changing environment of healthcare today call for a change in clinical education for nursing students. In response, a new advanced clinical education model must be developed and applied by representatives. So dear delegates, participants, kindly pay attention to today's sessions because it is very much necessary to attend today's scientific session by the eminent resource person, and hopefully the conference would be benefited and successful in all manner. Thank you so much. Thank you so much to all. Jai Hind, Jai Bharat.
Thank you so much, sir, for the motivational words. I invite Mr. Ankit Joshi to come forward and felicitate Dr. Farooq. Thank you, sir. Moving ahead, now I invite HN Kher, sir, Provost, Noble University, to come forward and speak a few words.
Respected VP Trivedi sir, Managing Trustee, respected KD Pandya sir, Co-Managing Trustee, Dr. Pragnaben Dabi, Registrar Gujarat Nursing Council, Dr. Kadiwala, Vice President Gujarat Nursing Council, all the dignitaries on dais, of the dais, participants from across the country, and my faculty members. It is a matter of immense pleasure for me to be with you in this pleasant morning. I congratulate our Bipin Bhai and his team to organize such a vital seminar, that is a futuristic, a national conference, particularly on futuristic approach towards nursing. Friends, you see that disease patterns are every time it is changing. If you see the last 4 centuries, every century you will get one pandemic. In 1720, we suffered from the plague. 1820, again cholera. 1920, Spanish flu. And again, you know that 2020, that corona. So every 100 years, we get one pandemic. And since the disease pattern is changing, because I understand that the nursing staff, nursing profession, they have got very good supportive role in the human health and human sciences. Their role is very vital because major responsibility come you. I have observed in during Corona, laboratory staff and nursing staff, they played a vital role as compared to doctors. No doubt credit went to the doctors, but major role was, vital role was played by the nursing staff and laboratory technician. This is my personal observation, what I have made it. Friends, every regular interval, I am talking about the every century we are getting one pandemic. But every regular interval, one disease enters in this country. I remember that in 1986, that was the 1st June, Mr. Makhija, a Sindhi fellow in Bombay, he had been to USA. He went under the open heart surgery, picked up the infection, and he suffered and he died of the AIDS. That was the first clinical case of AIDS in the country. And thereafter, unfortunately, every time I regret that we are very poor in prevention of the diseases. We are very good in control. Once disease spreads, we are very good in controlling the disease. I give you 4 or 5 examples and where is the role of the particularly nursing staff and how it is risky. So AIDS, now you know that number of cases are there because we didn't take care. Why I'm talking about AIDS? Because I was doing PhD at that time in virology, veterinary college, Hebbal, and my guide told me that you give seminar on AIDS. So I was the first person to give seminar on AIDS. What is the AIDS? And at that time, medicos people were there. This is the right time. Whoever enters in the country, he should be tested. Whether he's NRI or foreign, any foreigners is there, he must be tested against the AIDS. But we could not do it, and now number of cases have increased. Second very good example is the avian influenza in human being. When an outbreak was reported in the Bengal, I have given many lectures for awareness of the particularly in human being, the avian influenza. When it was knocking the door in particularly in our country, we didn't take care. and you see the number of cases have increased. Swine influenza, H1N1, H5N2, N1, that is the avian influenza. Once, don't be under impression that one disease comes, you will eradicate it. It becomes endemic. Every regular interview, you see, still we are claiming that swine flu is removed. No, it is not eradicated. Still, we are getting the cases of the swine flu. So once the virus or any disease enter, particularly infectious disease enters, then it becomes the endemic and we have to live with it. But virus is very smart. Sometimes I say that virus doesn't have brain. Being has brain. Virus doesn't have brain, but it is very smart. It changes. I remember that when I was offering the virology course, we used to teach coronavirus. Simply it causes the mild cold, nothing else. And now it has changed its virulence. That is called exaltation. It has increases virulent and it becomes so up till now we have reported 7 viruses, but last virus again within the virus some exaltation is then virulence is increasing, and that has created lot of problems in economy also. And then and sometimes we don't know the science, we create the havoc also. How to manage it we don't know, and we are creating. I will give you the 2 examples. When the avian influenza in human being it came, first outbreak was in poultry, and that omelette should not be eaten, all these things. 99.9% economic losses were due to over propaganda, and 0.1% losses were due to actual disease. Same thing has happened in the corona also. We don't know how to tackle it, and it is that nursing staff, it has handled it properly. That's why I appreciate that the nursing staff and laboratory technician, they have done marvel. Because you are here, that's why I'm not praising. This is personally I have observed they have done marvelous work. So these type of diseases, number of diseases, we are very lucky. One more disease, it is very difficult to control. That is called in human being, the Creutzfeldt-Jakob disease. This disease is caused by the not virus, not bacteria, not fungus. It is called prion. It doesn't contain nucleic acid. And a human scientist, he was neurologist, and he was seeing that some neurological disorders of people were coming to his hospital, and he worked for 10 years, Mr. Prussiner Stanley, a scientist. Actually, he was neurologist, and he worked on this one, and he proved that first time in the history. Generally, we say that disease is caused by such organism which contain nucleic acid, DNA or RNA. Here, nothing, no nucleic acid, no DNA. Only proteinous infectious particle, that is the prion. And it is a very dangerous disease. We don't know when it will enter in this country. But it has been reported in Britain and America that in sheep it causes the scrapie. Same agent it causes the mad cow disease in large animals, and then beef. When it is mutton, beef, it is done by the human being. In particularly in 1986, that mad cow disease, that causes the Creutzfeldt-Jakob disease. No treatment. Such agent, it is not inactivated. No formalin is working against it. It cannot be inactivated. No inflammation, no immune response. Such type of agent, once enters, it will be very difficult to control. Death is just like rabies. Death is the final outcome. We can't control such type of disease. So friends, when we are dealing with every interval, because you have to manage, new diseases are coming in the country, entering in the country, we are helpless, and we are not careful also after entering in the disease. Corona, same thing happened. I will give the last example of the corona, where we played the mischief. When we took decision, how corona has entered in this country? It was the 30th November, first case was reported in Kerala. That was by air only it has come. Now our policy was that you test the person, if temperature is there, then he will be isolated, otherwise he will be allowed. They don't know the incubation period is 2 to 14 days. If I have picked up infection today, after 2, 4, 5, 10 days, I may develop the symptoms. That we didn't take care, and we allowed the persons, and it spread like anything. If we had taken care, whoever enters, once we knew that there is an outbreak, it has from one laboratory, it has escaped the virus. we were knowing, and you know the risk. Doctor doesn't have risk. The laboratory staff and nursing staff, because you know, if you know that in one sneezing, 40,000 droplets are formed, and one droplet, you can't imagine number of virus particles. One droplet contains 20 lakhs virus particle. You can imagine in one sneezing how number of virus particles are spread in the atmosphere. And WHO said that it is not spread by the air. That was also the blunder. Once you sneeze it, virus particle, it survives in the 8 hours in the nature, and it can go up to 100 meters. Wherever person is there, he will get it. So such type of problem we have faced. We are using the 95 and mass. What is the size, pore size of the mass? 500 nanometer. Virus particle size is 100 to 110 nanometer particles. It can enter in this through the even your mass also. So why I am talking all these things? Because you have got great responsibility, because you will have to deal with the patient. Doctor will simply advise that you give you so much treatments. But after all, this is nursing staff. They take care of the patient. Along with this, the treatment, your behavior, that also helps a patient a lot. So today, in future, now we have never given importance to market-driven education. What is the demand in the market? This future, it is the market. What will be the demand in future in the market? So accordingly, you will have to revise your course. You will have to, even research also, market-driven research. It is said that 30% research is carried out depending upon the requirement of the industry and society. 70% is our fancy. So we have to see that what is the demand, particularly here also, education and research. You will have to revise your syllabus. You will have to get together. And what will the future requirement as per the disease pattern in the society? And accordingly, you will have to revise your syllabus, and your research also should be at par with the what is the demand in the society, what is the demand in the market. So I am sure that you are assembled here. Your topics are very good. I don't know much about nursing profession, but whatever I feel that you have a great responsibility in the society, particular human health is concerned. And I think that these seminars, they will come out with some fruitful suggestion, recommendation. You will implement in your life. You will revise according to your research strategy and your education, and implement in your portfolio. With this one, I wish you all the best. Jai Hind, Jai Bharat.
Thank you so much, sir, for your words of wisdom. I invite Professor Dr. Binu Joy, sir, to come forward and felicitate HN Kher, sir. Thank you, sir. Now I invite VP Trivedi, sir, Managing Trustee, Noble University, to come forward and speak a few words.
આજના આ સેમિનારના આદરણીય અને સન્માનનીય ચીફ ગેસ્ટ પ્રજ્ઞાબેન. પ્રજ્ઞા અહીંયા બુદ્ધિ તેજ બધું અહીંયા જ છે એવા વિદ્વાન બેનને નમસ્કાર કરું છું. નર્સિંગની સંસ્થાઓ અને કાઉન્સિલ બે વચ્ચે કડી રૂપ બને એવા કડીવાલા સાહેબ, આપનું પણ અહીંયા સ્વાગત છે. અમારા ટ્રસ્ટના પ્રેસિડેન્ટ શ્રી નિલેશભાઈ ધુલેસિયા અને વાઇસ પ્રેસિડેન્ટ ગિરીશભાઈ કોટેચાએ આ સંમેલનને ખૂબ ખૂબ સફળ થાય એવી શુભેચ્છા પાઠવી છે. અમારા કો મેનેજિંગ ટ્રસ્ટી પંડ્યા સાહેબ, મારા ભાણેજ એમ કહું તો હાલે, મંચસ્થ મહાનુભાવો દાદા બાલાજીથી પધાર્યા છે, અમારે અમુભાઈ આવ્યા છે, આ બધા મહાનુભાવો સ્ટેજ ઉપરના બધાનું સ્વાગત કરતા આનંદ અનુભવું છું. આનંદ અને ગૌરવ તો એ વાતનો છે કે આ કાઉન્સિલે આ કોલેજને આવી તક આપી, અમને આવું સરસ એક લાભ આપ્યો, એ માટે કડીવાલા સાહેબ, બેન અને આયોજકો, ડોક્ટર સાહેબ બધાનો હું ખૂબ ખૂબ હૃદયથી એક આભાર પણ માની લઉં સાથે સાથે કે અમને આવી એક સુંદર તક મળી છે. આ સંસ્થા કાયમ માટે આપની છે એમ માનજો. ગમે ત્યારે કોઈ પણ કાર્યક્રમ કરવો હોય ત્યારે તમારા માટે આ સંસ્થા ખુલ્લી છે. હવે ખાસ એ કહેવાનું કે નર્સિંગ વ્યવસાય, લેડી વિથ ધ લેમ્પ, ફ્લોરેન્સ નાઇટિંગેલને યાદ કરીએ આ વખતે, વંદન કરીએ એમને કે જેમણે આ વ્યવસાયને ઉજ્જવળ બનાવ્યો છે. ડોક્ટર ત્યારે જ સફળ થઈ શકે કે જ્યારે નર્સિંગ સ્ટાફ એલર્ટ હોય. એ ના હોય તો પેશન્ટ કોઈ દી સફળ ના થઈ શકે. અમારા ડોક્ટર ખેર સાહેબ એ વેટરનરી સાયન્સમાંથી આવે છે. આપણે જે સેવા કરીએ ને એ પેશન્ટને પૂછીએ, પેટમાં દુખે જ, માથું દુખે જ, શું થાય છે, તકલીફ શું છે કયો. એમણે તો એવી સેવા કરી છે કે એ કાંઈ બોલે જ નહીં, એનું પ્રાણી આવીને ઊભું રહીએ 4 પગે, હાથ ફેરવીને નક્કી કરીને દવા કરવાની. એને હું માંદગી છે, આપણે તો સોનોગ્રાફી કરી અને ડોક્ટર કહે કે જાઓ રિપોર્ટ કરી આવો, બ્લડ ટેસ્ટ કરી આવો. આ તો કાંઈ કર્યા વગર મૂંગા પ્રાણીઓની સેવા કરી છે. અને અમને આવા વાઇસ ચાન્સેલર મળ્યા છે, એ પણ એક આ સંસ્થાનું ગૌરવ છે. આપ જે ભૂમિમાં અત્યારે આવ્યા છો, આ કેમ્પસ પરવીન બાબીનું ફાર્મ હાઉસ હતું, એ અહીંયા જ મોટા થયા છે, અહીંયા જ ઉછરા છે, અહીંયા જ રહેતા. એટલે આ જગ્યા છે એ પણ એક કંઈક આમ વ્યવસ્થિત સારી અમને સુકનવાળી છે એવું અમે માનીએ છીએ. આપ સૌ અહીંયા પધાર્યા, અમને ગૌરવ અપાવ્યું, એ માટે પણ આપનો આભાર. અને ફરીને આપને વિનંતી કરું કે હોસ્પિટલમાં એવું કામ કરજો કે દર્દી ઘણા કણસતા હોય, રડતા હોય, દુઃખી હોય, આ જોને મારું લોહી પી ગયો, આ બેહવાય નથી દેતો, આવું ના વિચારજો. પણ તમારા દર્શન માત્રથી એની માંદગી વહી જાય ને એને એમ થાય કે હાસ બેન આવ્યા છે કે ભાઈ આવ્યા છે, મને સારવાર આપે છે, હવે હું સાજો થઈ જઈશ. એવી ભાવના તમારા દર્શન માત્રથી પેશન્ટમાં ઉત્પન્ન થાય, એવું તમારો વ્યવહાર કાયમ ને કાયમ વધતો રહે, એ અપેક્ષા સાથે હું વિરમું છું.
ખૂબ ખૂબ આભાર, sir. To felicitate sir, I invite Professor Himanshu Trivedi sir to come forward and felicitate VP Trivedi sir. Thank you, sir. Now it's time to listen to the man of the hour, Mr. I.A. Kadiwala, sir. Sir, I welcome you to come forward and speak a few words.
બધા એકદમ શિસ્તબદ્ધ રીતે ફેકલ્ટી ઊભા છે એટલે બેઠા છે. નોબલ અને ગ્લોબલ બેનો જ જમાનો છે અત્યારે. ભગવાન શંકર દાદાની તળેટીમાં આપણે સૌ બેઠા છે, એટલે કે ગિરનારની તળેટીમાં, અને સામે નજીકમાં સોમનાથ. સંસ્કાર, સંયમ, વર્તન અને વાણીનું કોમ્બિનેશન એટલે ડોક્ટર પ્રજ્ઞાબેન ડાભી. સૌરાષ્ટ્રનું સંતાન છે સાહેબ, અને આ સૌરાષ્ટ્રની ધરતી પર આવી નેશનલ કોન્ફરન્સ પહેલી વાર થયેલી છે જુનાગઢમાં. ડૉક્ટર પ્રજ્ઞાબેન ડાભી મેડમ, અમે તો મામા જ કહીએ છીએ, વીપી ત્રિવેદી સાહેબ, કેડી પંડ્યા સાહેબ, એચએન ખેર સાહેબ, ખૂબ સારું નોલેજ છે રજિસ્ટ્રાર સાહેબને. આમ તો વેટરનિટીમાંથી પણ એમને જે પ્લેગવાળી અરે એઇડ્સવાળી અને કોરોનાવાળી વાત કરી, બહુ પરફેક્ટ આંકડા સાથેની માહિતી હતી. રોનક હુસેન, રજિસ્ટ્રાર નોબલ યુનિવર્સિટી. ફારૂક ખાન સર, તાળીઓથી વધાવો. આપણે એનટીઆઈના પ્રેસિડેન્ટ છે અને ગુજરાત પ્રત્યે હવે આપણે એને ગુજરાતી જ બનાવી દઈએ છે. બીનુ જોય સર, રાજકોટ, એ ધૂમ મચાવે છે સૌરાષ્ટ્ર નહીં પણ આમ ગમે ત્યાં કોન્ફરન્સ હોય અને 10 વાર તો આપણને ફોન કરે. મનસુખ કાકા, બાલાજી, જોરદાર તાળીઓથી અમે એમને મનસુખ બાપા જ કહીએ. સાહેબ, હું 2 વાર ઇલેક્શન જીત્યો ને, મારે માણસો ઓછા પણ મજબૂત માણસો મેં 5 જ ગણેલા. બિપિન પંડ્યા સાહેબ, સૌસાણી સાહેબ, મનીષભાઈ અને ગુરુજી. રાજકોટ હજુ બાકાત રાખું છું પણ શરૂઆત જુનાગઢથી થાય અમારી. એવા અમે એમને ગુરુજી તરીકે જ વર્તીએ છીએ. એવા બિપિન પંડ્યા સાહેબ ક્યારેય ઈમાનદારી અને વફાદારીનું જો ઉત્તમ ઉદાહરણ હોય તો બિપિન પંડ્યા સાહેબ, એમાં કોઈ શંકાને સ્થાન નહીં. ગુરુજી બરાબર ને? આપણી વચ્ચે ઘણા બધા મહાનુભાવો છે, બહુ મોટું લિસ્ટ છે પણ મારે બોલવું પડે કેમ કે એમનો સહયોગ અમારી લાઈફમાં આ કડી બોલે, કડીવાલા બોલે એ બનાવવામાં બહુ મોટો યોગદાન છે. જે લોકોના નામ બોલું ને તેના. ફાલ્ગુની બેન, જેને એસએનએની કોન્ફરન્સ કરેલી જ્યારે અમારો કોઈ હાથ નહોતો પકડતો, એવા ફાલ્ગુની બેન મોદી વીએસના પ્રિન્સિપાલ. ત્યાર પછી હેમાંશુભાઈ, મેડમ અલકા તેજને, મારા જીગરી મિત્ર અને આજના ઓબ્ઝર્વર રાજેશભાઈ ઠુમર, સામે બેઠેલા નર્સિંગ સુપ્રિન્ટેન્ડન્ટ મનીષભાઈ હળિયા, હેમદીપ પટેલ, ટીએનઆઈ જોઈન્ટ સેક્રેટરી, જયેશ જૈન, પદ્મકુમારજી, હેમાલીબેન, મુડુભાઈ કારેણા, ચિરાગભાઈ બ્રહ્માનંદમાંથી આવેલા. ત્યાર પછી અભિનવ, અમુભાઈ, સ્તુતિબેન મેકવાન, ભાઈ દક્ષેશ. આ દક્ષેશ હોય છે ને એક જોડતી કડી જ છે. એટલે એ તમે આપી દો તો વાંધો નથી. પછી ભાઈ વિજય પોરબંદરથી પણ આખી એક ટીમ આવી છે અહીં આગળ અને ખૂબ શાંત અને સરળ આજના ડેલિગેટ્સ એકદમ શિસ્તબદ્ધ રીતે બેઠા છે. એટલે કંઈક મેળવવા આવ્યા છે એ વાત નક્કી છે. બીજે બધે એવું હોય છે અડધા ઉઠીને જાય. હમણાં અમારે એક પ્રોગ્રામ હતો પાટીલ સાહેબનો, તો ભલતી કોલેજના હોમિયોપેથિક બોલાવેલા, નર્સિંગ વાળા ચૂપચાપ બેઠેલા અને પેલા દોડા દોડ કરે. પેલા મને એવું કીધું કે આ તમારા વાળા દોડે. મેં કહ્યું મારું બાળક ગુજરાતમાં ક્યાંય ઊભું ના થાય, એ તમારું 4 કલાકમાં ઊભું થઈ જાય, આ નક્કી. અને તમે જઈને પૂછ્યા આવો જાય, હું ગેરંટી આપું છું એ બાળક ઊભું થઈને બહાર જાય. તો પેલા પૂછવા ગયા હતા કે કઈ પચ્ચીગર હોમિયોપેથિક માં આવ્યું ને, તમને કોઈ નર્સિંગ વાળું ઊભું થઈને જોવા ના મળે. એટલે વડાપ્રધાન સાહેબનો કાર્યક્રમ હોય કે નાનો કાર્યક્રમ હોય, શિસ્ત અને સંસ્કાર હોય ને તો એ નર્સિંગ સ્ટુડન્ટમાં હોય સાહેબ. અને કોને આભારી છે? ફેકલ્ટીને આભારી છે. અને હવે પહેલા તો હું ને પ્રજ્ઞાબેન કે પંડ્યા સાહેબ પાસે બનતા હશે ત્યારે આપણને કંઈ ડીજે ફીજે નહોતું, પણ પછી કોન્ફરન્સ પછી છેલ્લે ડીજે ફીજે આપે છે એટલે ઓર કોઈ સવાલ નથી. તમે કોઈ વાર જોયું સાંભળ્યું આખા ગુજરાતમાં કે નર્સિંગ સ્ટુડન્ટ દારૂ પીધેલા પકડાયો? મેડિકલની કોઈ છોકરી પકડાઈ હશે, તમે આ સાંભળ્યું? ક્યારેય નહીં સાહેબ. આપણું બાળક એ ગુજરાતી દાળ ભાત શાક રોટલો ખાઈને પણ સંસ્કાર અનુભવે, પેલો ભૂરિયાઓ બ્રેડ બટરથી પણ એ અસંસ્કારી થઈ જાય છે. આ હકીકત છે. છેલ્લે છાસ તો પીશે અને પેલા હોય છે કે બિયર છે, ફોરેન વાળા એવું કે અમારે એ ગુજરાત જોઈએ છે. હું આજે 2 જ બાબતો કહેવા આવ્યો છું. અમને ખૂબ વોટ આપ્યા 2 વખત. પહેલી વાર વોટ આપ્યા ત્યારે આપણે 10x10ની ખોલીમાંથી ગુજરાત નર્સિંગ કાઉન્સિલને ઓનલાઈન થઈ ગઈ, તમામ પ્રક્રિયા ઓનલાઈન. આજ ટ્રસ્ટીઓ અમુભાઈને કદાચ 5-6 કલાક બહાર બેસવું પડતું હશે જસુબેનના રાજમાં.
જ્યારે પ્રજ્ઞાબેનના રાજમાં તમારે બેસવું નથી પડતું, બધું જ ઓનલાઈન સાહેબ. જોરદાર તાળી જાય આવાસમાં. અને તે સૌરાષ્ટ્રની ધરતીનું સંસ્થા છે સાહેબ, રજિસ્ટ્રાર ગુજરાતી, બરાબર. અને એ પણ તમે ત્યાં જાઓ, ખાલી તમારે મળવા જવું હોય તો જાઓ, બીજી આડી અવડી વાતો માટે તો તમારે જવું જ નથી પડતું. હમણાં પણ જીએનએમની પરીક્ષા કદાચ ગઈ, આજે પતી જ ગઈ હશે કે ચાલુ છે, પેપર નીકળે છે સાહેબ. કદાચ નર્સિંગનું પેપર ફૂટ્યું એવું લાગ્યું જીએનએમનું, એ મને કહો કોઈ, તો તાળી થાય કે ના થાય? અમે તો ખાલી એમાં કમિટીમાં છીએ, બધું તો કરવાનું એમને છે. એટલે હું બોલ્યો સંયમ, સંસ્કાર, વાણી અને વર્તનનું કોમ્બિનેશન હોય તો ડોક્ટર પ્રજ્ઞાબેન ડાબી સાહેબે કોરોનાની વાત કરી. આખા દેશમાં વેક્સિન કોને આપી હશે? સ્ટુડન્ટ નર્સ કે સ્ટાફ નર્સે આપી હશે. બીજો તો કોઈ ડાક્ટર તો આપવા ગયો નહીં હોય ને. એ ગર્વ આપણે લેવાનું છે. વડાપ્રધાન સાહેબને કેરાલિયન નર્સિસ કોઈ આપતા હતા, એમ્સના નર્સિસ હતા. આખા દેશમાં 200 કરોડ વેક્સિન આપી, તે કોને આપી? નર્સિંગ સ્ટાફે આપી. અને આ જ નર્સિંગ સ્ટુડન્ટ ગુજરાતના એવા હતા કે સાહેબ, પહેલા ગુજરાતના વિદ્યાર્થીઓ ડૉક્ટર જયંતિ રવિ મેડમે એ હોસ્પિટલમાં કીટ પહેરીને મોકલ્યા, એ ગુજરાતી નર્સિંગ સ્ટુડન્ટ હતા. ત્યાં તો આફ્રિકાથી તો કોઈ આવ્યું જ નહોતું ને, આપણે ગયેલા હતા. અને આજે દેશ કોરોના મુક્ત થયો. નાની મોટી ગરબડ થયા કરે, પરંતુ આપણે તો શાંતિથી આજે કોન્ફરન્સ માલીએ છીએ. આ 3જું વર્ષ છે અને એ તમામ એ ટેકનિશિયન અને નર્સિસ પેલા તો રિપોર્ટ લખીને જતા રહેતા હતા, પરંતુ નર્સિંગ સ્ટાફ, નર્સિંગ સ્ટુડન્ટ, ઇવન ફેકલ્ટીને પણ કામે લગાડ્યા. એના દ્વારા આપણે કોરોનામાંથી બહાર આવ્યા. અને ખાસ કરીને જીએમઈઆરએસ જુનાગઢ અને પોરબંદર સિવિલને પણ આપણે અભિનંદન આપીએ. નજીક છે એટલે કહું છું. પોરબંદરના અને જુનાગઢ, રાજકોટ એ બધા સ્ટાફોએ, ગુરુજી છે પોરબંદરથી છે, હળિયા સાહેબ ઉભા થાવ જરા, આપો તાળી વધાવો જરા, કરવું પડે. આ તો રાજકોટમાં તો રાજકોટ વાળા ઉભા કરતે, પણ આ લોકો એક વહીવટી હતા. અને જે કંઈ વહીવટી થઈ, સ્ટુડન્ટને જે કંઈ નાની મોટી તકલીફ પડી હોય, પણ આજે ભગવાન ભોળાનાથના ધામમાં શાંતિ તો છે ને. અને આગામી 5 વર્ષ જોજો સાહેબ, इंडिया में बदा बुरिया होता होता ना तब मन क्या जो कि रजिस्ट्रार मैडम कहाँ पे है, गुजरात नर्सिंग काउंसिल क्या है, नोबल क्या है, मामा होता आवशे, लखी राखो मारा शब्दों. केम के हवे बो नजीक में छे, आपणे पेला जे 2 वर्ष हता हवे गेरंटी वाला वर्षो छे, एमां कोई सवाल नहीं एम. अने गेरंटी वाला वर्षों में बधा ज जे 1000 वर्ष पहला लीधेला मंदिरों पुनर्जीवित थशे अने आ आपणी संस्कृति વધુ સારી થશે સાહેબ. અને નર્સિંગનો જ જમાનો આવશે, એમાં કોઈ શંકાને સ્થાન નથી. પ્રિન્સિપાલો, ફેકલ્ટી બધાની મહેનતથી છેલ્લા 3-4 વર્ષમાં ગુજરાતના 350 થી વધુ બાળકો એમ્સમાં લાગ્યા સાહેબ. અને ક્રેડિટ ના કહેવાય, શું કાંઈ જોરદાર તાળી પાડો ફેકલ્ટી અને પ્રિન્સિપાલ માટે. અને હું એવી આશા રાખું આ કોન્ફરન્સ હોલમાં અને જેટલા બહાર છે તે ગુજરાતના વિદ્યાર્થીઓમાં કે સાહેબ, આપણે ભલે ગુજરાતી છીએ પણ આપણું બાળક બહુ પરફેક્શન, એનું હિન્દી હોય તો બહુ પરફેક્ટ હોય, એની ગુજરાતી હોય તો બહુ પરફેક્ટ હોય, એની અંગ્રેજી હોય પર આપણે છે ને ભૂરિયાઓની ભૂલ શોધવાની હોય. અંગ્રેજી તો આવડવું જ જોઈએ. તમે જાઓ વિદેશ, અહીં લાવો, ગરબા ગવડાવો, એને સાડી પહેરાવો, કેમ છો બોલાવડાવો, આ બધું જ કરવાનું. મામા ગુજરાતીમાં બોલ્યા. વડાપ્રધાન સાહેબ પેલા મસ્ક ખાતે બેઠેલા હિન્દીમાં વાત કરતા હતા ને બુરીઓ એનું ટ્રાન્સલેટ કરતો હતો કે નહોતો કરતો. ભાષા અગત્યની નથી, પણ નોબલ યુનિવર્સિટી હોય કે બાલાજી હોય કે પોરબંદર નર્સિંગ કોલેજ હોય, ગમે ત્યાં હોય, આ ત્યાંનું બાળક દેશ અને દુનિયા સાથે નર્સિંગની કોઈ પણ રિસર્ચ માટે, કોઈ પણ બીજી કોઈ પણ સારી, ધારો કે કોરોના છે, કોઈ એની થીસીસ કંઈ પણ ઉપર રીલ બનાવો, બીજી રીલ ના જોતા, આખો વર્લ્ડ તમને જોશે સાહેબ. અહીં કંઈ નહીં આવડતું, અંગ્રેજી આવડતું જ નથી બોલતા સાહેબ, હા મામા જરાય નહીં. પણ એનું ટ્રાન્સલેશન આ પ્રજ્ઞા મેડમને બધાની જોડે જોડે, ફાલ્ગુની બેન ને આશાબેનની જોડે રહી, ઇન્દ્રાવતી મેડમની જોડે રહીને શીખી ગયા. મારે અભિનંદન પંડ્યા સાહેબને એ આપવા છે કે સાહેબ, તમે આ પહેલી નેશનલ કોન્ફરન્સ કરી, તમારી પાસે સરકારી નર્સિંગ કોલેજમાં અનેક વિદ્યાર્થીઓ પાસ થઈને ગયા. તમે પૂછો કે જુનાગઢનું સ્ટુડન્ટ, તો આપણે એવું કે પંડ્યા સાહેબનું સ્ટુડન્ટ, સવસાણી સાહેબનું સ્ટુડન્ટ, ઠુમ્મર સાહેબનું સ્ટુડન્ટ, આવું કે હા હું એમની સ્ટુડન્ટ, એવું ગર્વથી બોલે સાહેબ. સુરતમાં તો ઇન્દ્રાવતી મેડમ કોન્ફરન્સ કરે કે કેમ કે અમારા જેવા ત્યાં બધા હોય, પણ જુનાગઢમાં તમે કરો અને તમારી જે આખી ટીમ છે બધી જ કોલેજોમાં પણ તમે આ જે કર્યું છે અને એનટીઆઈની ટીમને લઈને કર્યું છે, હું અભિનંદન આપું છું તમને. હેમંતભાઈ, આપણે અભિનંદન આપીએ એમ, કેમ કે આમાંથી કંઈક તો કોઈક બાળક મેળવશે, એમાં કોઈ સવાલ નથી. એટલે કે અમે તમને ગોડફાધર તરીકે કોઈ ભાષણમાં કીધું કે ગોડફાધર છો તમે, અને છો જ. બિનુભાઈ સાહેબે જ કદાચ કીધું કે ગોડફાધર છો, અને પંડ્યા સાહેબને લોકો આદરથી બોલાવે. બિલકુલ કે ભાઈ બિપિનભાઈ પંડ્યા સાહેબ. ક્યારે કોઈ સાથે ઝઘડો થયો એવું મેં નથી સાંભળ્યું. ફરી તમે નેશનલ ને ઇન્ટરનેશનલ કરો, મને તાવ હતો તો પણ મેં કીધું કે આ કમિટમેન્ટ છે અમારું તમારી સાથે. અને પ્રજ્ઞાબેન છેક સવારે 3 વાગે ઉઠીને ત્યાંથી આવ્યા છે અમદાવાદથી, અને પાછા અત્યારે જવાના છે. બાળકોનો ઉત્સાહ અને ઉમંગ વધારવા માટે અમારી હાજરી છે. આ મુદ્દા મેં ઘણા બધા લખ્યા છે. કોરોનામાં મનીષભાઈ હડિયા, સૌસાણી સાહેબ, પંડ્યા સાહેબની મહેનતથી અહીં પણ અમારો જે ભાઈ હતો પેલો ટ્યુટર વિપુલ, એવા 15 નર્સિંગ સ્ટાફ ગુજરાતમાં એક્સપાયર થયા. એઝ એ ટીએનઆઈ, એઝ એ કાઉન્સિલ, પ્રજ્ઞા મેડમની મહેનત, પ્રભાકર સાહેબની મહેનત, બધાને 50-50 લાખ રૂપિયા મળી ગયા છે. 15 કરોડ રૂપિયા. કહેવાનો ભાવ છે કે આપણું ટીમ વર્ક હોય ને તો બધું જ શક્ય છે. કોઈના પોઝિટિવ નેગેટિવમાં અમે નથી પડે, પણ એને પરિવારને 50 લાખ રૂપિયા રેમ રાહે નોકરી સરકારમાં હોય તો એના પૈસા, તો એટલીસ્ટ આપણે સપોર્ટ તો મળે. એટલે આ રીતની ગુજરાત નર્સિંગ કાઉન્સિલની ડૉક્ટર પ્રજ્ઞાબેન ડાભીના નેતૃત્વમાં કામગીરી ચાલી રહેલી છે. તમે બધા જ બાળકો ખૂબ ધૂમ મચાવો, ગુજરાતનું નામ રોશન કરો. બીજી વાત તમને કહું કે હું આઈએનસીમાં જાઉં, લગભગ બધા રજિસ્ટ્રાર હોય, પણ ગુજરાત છેલ્લા 2016 પછી હું મંચ પરથી કહું છું કે દેશની સૌથી સારી નર્સિંગ કાઉન્સિલ જો હોય ને તો એ ગુજરાત નર્સિંગ કાઉન્સિલ. અને એના માટે જો ક્રેડિટ જતી હોય ને તો પ્રજ્ઞાબેન અને એમની ટીમને, કેમ કે એ લોકો આમાંથી અહીં આવીને પણ ગયા રજિસ્ટ્રારો. અને 2020નો જે નેશનલ ફ્લોરેન્સ નાઇટિંગેલ એવોર્ડ વહીવટનો જે દેશમાં એક જ માત્ર એવા રજિસ્ટ્રાર છે ડૉક્ટર પ્રજ્ઞાબેન ડાભી, જેને મળ્યો છે. કોઈ રજિસ્ટ્રારને મળે એવી ઘટના નથી. 2016 પહેલાના રજિસ્ટ્રાર ધારતે તો નેશનલ એવોર્ડ લઈ આવતે, પણ રદ્દી જેવી માર્કશીટ. કારેના સાહેબ બરાબર ને, 2 કલાક બેહાડી રાખે. સૌસાણી સાહેબ, હું ખોટું કહું છું? હે ભાઈઓ ના ગમે કોઈને, પછી સૌરાષ્ટ્રથી આવ્યા હતા કે બેસી રહો, કાલે આવજો. લે ભાઈ, છેક રાજકોટથી, જુનાગઢથી, પોરબંદરથી આવેલો માણસ ગુરુજી, ત્યાં અમદાવાદમાં આપણું કોઈ ખરું? કોઈ આપણને રાખ્યો હોય ના. આપણે તો રૂમાલ ના લઈ ગયા હોય જોડે. પાણીનો ભાવ નતા પૂછતા. સાહેબ, તમને ત્યાં જાઓ, ચા પીવડાવશે, હું ગેરંટી આપું તમને. અમારે કહેવું પણ નથી પડતું. ફરિયા સાહેબ પીવડાવે છે કે નહીં? હું બાળકોને એ કહેવા માંગુ છું કે 2016 પહેલા ગુજરાત નર્સિંગ કાઉન્સિલની પરિસ્થિતિ બહુ જ ખરાબ હતી, બહુ જ ખરાબ. હું પોતે દુઃખી હતો, હું તો લીડર હતો, મને તો આવવું જ નહોતું. પણ મેં કીધું ભાઈ આવો સાફસૂફી કરો, કોઈ ગુજરાતી આવે તો એનું નામ રોશન થાય. એટલે फारूक ये रजिस्ट्रार मैडम आने के बाद एनटीआई भी यहाँ पे आया, तो आप उनका शुक्रगुजार अदा करो कि आपको आने का चांस मिला यहाँ पे. छेल्ली पाटली पर बैठेली दीकरी के दीकरो मन मूकीने पीएचडी करे, मन मूकीने भूरिया साथे आंखમાં આંખ મિલાઈને વાત કરે અને દેશનું નામ રોશન કરે અને નર્સિંગનું નામ રોશન કરે. એ જ શુભેચ્છા. ભારત માતા કી જય. વંદે માતરમ.
Thank you so much, sir, for the marvelous words. I would like to invite Dr. Farooq Khan, President NTAI, to come forward and felicitate Mr. I.A. Kadiwala, sir. On behalf of Noble University, we would also like to felicitate Mr. Mansukh Bhai, Trustee Balaji Nursing College, for making the highest registration of today's conference, that is 121 registrations. Thank you so much, sir. To felicitate, sir, I invite Mr. Bipin, sir, to come forward and felicitate Mansukh Bhai. As we are progressing on to forward, there are some valuable messages from our patron of National Nursing Scholar Society. They will be joining us online. To begin with, we have Dr. Bimla Kapoor Madam, Advisor, National Nursing Scholar Society. We will be listening to Madam through online.
Who's asked to speak, please?
Madam, we can hear you, ma'am.
Hello?
Hello. Good morning, ma'am.
Yeah,
We can hear
yeah.
you, ma'am. Yes, ma'am. Over to you, ma'am.
Oh, am I speaking?
Yes, ma'am. Yes, ma'am. You're audible, ma'am.
Oh dear, oh dear. Dignitaries on the dais, Dr. Sue Khanna, the patron for NTI, for NSS, for CNRS, Dr. Pragya Ventabi, the registrar, Mr. Kadiwala, the presidents of NSS, national as well as state level, and NTAI, also the principal College of Nursing, uh, Dr. Jindal, Dr. Bipin, who is the director, College of Nursing, Noble College of Nursing and its management, dignitaries of the university, participants offline, online, and very, very dear students. Let me congratulate first to all the three associations, the three organizations, not the associations, three organizations to have come together and make a committee to work together with the message to convey to whole world that nursing starts from the College of Nursing or nursing institutes. And that's how the Noble College of Nursing has taken initiative to have this first of its kind 2 days national conference at Junagadh, which I understand is such a large number happening first time from Mr. Kadiwala. So congratulations to Noble College of Nursing and to the management of Noble College of Nursing, without support, probably it will be difficult for the principal to organize such a huge conference. Also, the committee members are talking now of the leadership. I think this is a very blended example or a good example of leadership where all the three leaders have come together. That is the College of Nursing, the educational institution. Number two, you have the Scholar Society, Nursing Scholars Society, and the third one is Nursing Teacher Association. Now, if you look at the essence of this, that this leadership is organizing the futuristic approach towards the nursing practice. Imagine the things which is in the mind of the student who comes first day to the College of Nursing, whether it is a Noble College, through the Noble University, or to any other college in the country, all the world over, needs to learn what is going to happen hence after 20 years. So this conference is being organized for the students also of the College of Nursing. And I'm so happy the theme which is chosen is so appropriate. Look at the Nursing Teacher Association of India participating, because teachers need to be prepared to deal with all kind of futuristic approach to the nursing. I mean, I heard one of the August speaker was talking about HIV/AIDS. We are talking of artificial intelligence now, because things were happening so very far back, and now things are going to happen which we really do not know how we have to meet those challenges. Then look at the Scholastic Society, the Scholar Society, that they are saying, no, let's not stop at teaching, but let's do some scholarly work and evidence-based work and the research innovative research which will help us to implement the evidence-based practice for the patient care improvement. So, but you can see the many innovative syllabi are being, developed and being propagated and being told to people to practice. Uh, the very important one is we have the nurse practitioners, midwifery nurse practitioner, mental health nurse practitioners, pediatric nurse practitioner. In all the specialty area, the nurse practitioners are required. Of course, the via media, the nitty-gritty, the principles, the approach needs to be worked out definitely. Nurse-led midwifery clinic are already in vogue. Artificial intelligence is getting into the preparation of nursing professional. Look at the climatic change and impact on the curriculum of the nursing and the medical group, that how you will have to manage the various disease conditions, also forensic nursing. So all these things are going to have impact on the healthcare system, and so is on the nursing. So what I'm trying to say is that these aspects are part of the futuristic nursing. These are few of the examples I have given you. There may be enough number of examples which you can quote yourself. The very fact that three important groups are working here today is very significant to see that nursing does not get diverted into teaching, into practice, or into the research. Anybody who's doing the research brings it back to the practice in the clinical area. Whether the teachers or the clinical staff is doing research, brings back to the clinical area and also incorporate those kind of teaching in the classroom. What is the ultimate goal? Whether it is a health, medical sciences, pharmacology, virology, talk of anything, the essence is the patient. The patient has to get best of care. These conferences, these outcome of the conferences at any level should come out with a very good concept paper of improving the patient care. And we should not forget all over the world, anybody who's existing in the health system is existing for one particular person who is a patient most of the time, to whom we forget, and we have no right to forget. Now, how do we want our nursing teacher to develop the nursing students? See, those are the old lecture methods which we considered. We talked about outcome-based teaching methods, which is being talked about now also. But we also talked about the students who will listen in the classroom. But now the students don't listen. The word which they don't understand, they ask the teacher or they immediately Google on the phone under their table, which teacher may not even come to know. So we are having a very well informed students, very well informed nurses, very well informed scholars, but we also have very well informed, intelligent consumers of healthcare system. So we have to develop our futuristic nursing approaches based on who's our client now. The clients are not, even in the village, the patient is going to say, yesterday I was getting a red tablet. Why are you giving me today yellow tablet? The patient asks us, and we cannot say, who are you? You are a patient. I am the nurse or I am the doctor. Gone are those days when you say, I am the doctor or I am the nurse. The patient has right to know because it is his body, her body, which is being treated and has right to know. It was always there, but people did not ask questions. But now they are trying to ask the questions, and we, through this futuristic approach, needs to be more communicative, needs to be more empathetic, needs to be more specific to the patient care and inform the patient about what care is being given. The competencies which you draw through these kind of learning atmosphere. I call it as a learning atmosphere because you interact with so many experts during the conference. You interact with the registrar, you interact with the teacher, you interact with the students, you interact with the staff nurse, you interact with the CNO. So there are a variety of people with whom you are interacting, and this gives you the opportunity to learn more and more. Now, I must congratulate the organizing professionals sitting over there day in and day out working along with the help of Noble Management and Principal College of Nursing and her team, his team, and of course the Mr. Bipin, who has been really instrumental in seeing that things happen. It's very easy to say that the conference is being organized, but it takes months and months together to plan, to organize, to invite, to see that it is, done effectively with the objective what was presented. With these few words, may I take opportunity to congratulate each one of you who have been organizing, also the speakers who have come all the way, and the participants, dear participants, who had been here, who are here since yesterday, presenting and listening to, will be listening to people and give your opinion freely so that we can incorporate it. Once more, I would like to congratulate the management of Noble College of Nursing, along with the principal and their team, for having a beautiful setup of the whole national conference. And I wish you all the best for the conference. Do admire and see Junagadh. You may not ever get an opportunity to visit. With some of us, we are missing. God bless you all, and I wish all the success for the conference. Thank you so much.
Thank you so much, ma'am, for your wonderful words. It is always a blessing to listen to you, ma'am. Thank you. Next, we are going to listen to the patron of National Nursing Scholar Society, Dr. Suresh Narula Khanna, ma'am, who is joining us all the way from Canada through online.
Thank you very much. Namaskar and greetings from New York, USA. Respected dignitaries on the dais and our chief guest, Pragnaji. I was so lucky to see her and meet her in January in Surat. And our Kadiwalaji, always having a soft corner for the nursing. And Shri Nitesh Bhai, Dulesia ji, Dr. H.N. Kher, our all esteemed trustees, Quincy Chapter President Shri Vipin Pandya ji, NTAI Branch President Shri Himanshu Trivedi ji, National NSS Dr. Binu Sir, and NTAI President Dr. Farooq Khan, and our all the experts, speakers, our lovely students, our audience, and I see our SNT President Dr. Ashia Qureshi ji also here. Good to see you. And it is indeed honor and privilege for me to be connecting with all of you through this Zoom for this national conference on the futuristic approach towards nursing practice. Now, this 2 days conference will focus on future of nursing in the digital age, future trends in nursing, research and education, nurse practitioners in clinical practice, policy making strategies, role of the nurse, leadership and advocacy to develop a positive future for the profession, etc. The research paper presentations will further enhance the motivation for the students and will focus on the findings and implications which will be used with all of us in the quality nursing care of the patient. I wish for brilliant success in our national conference and God's blessings. And now all the speakers before me have said so much. So without taking time, and that I am going to just say that I'm going to miss Bhavan Nath Temple and other attractions in Junagadh. But anyway, thank you for inviting me, and I am honored and humbled. Namaskar, and I will say good night.
Thank you so much, ma'am, for the blessings. We really appreciate your enthusiasm and waking up so late at night just to
That's
deliver
all.
and give us a message. Thank you so much, ma'am.
Good night.
Now, let me invite Dr. Asha Qureshi, ma'am, President SNT, to join us online and speak a few words. Over to you, ma'am.
Can you hear me? Good
Yes,
morning.
ma'am. Yes, ma'am. You're
I'm
audible.
audible?
Yes, ma'am,
Okay,
you're audible, ma'am.
thank you. Dignitaries on the dais, students, faculty, guests, and participants. Good morning, everyone, and greetings. Futuristic approach in nursing practice. What a brilliant theme for the conference is chosen by the organizing committee. That is where we will be after 10 years in 2030 and 40 and so on. Dear friends, gathered in Junagadh for attending this national conference, all of you know that, with care expanding now beyond the walls of the traditional healthcare setting, including hospitals and clinics, the deployment of advanced technology as artificial intelligence and telehealth, artificial intelligence and telehealth is one of the very, very important topic nowadays to be covered. Robotics, use of robotics, use of sensors, and other digital technologies can assist nurses in connecting to healthcare network, reaching individuals in their homes and other settings, and promoting well-being of individual, family, and community at large. The future of nursing practice demands a more stronger, more diversified nursing workforce to provide care in all settings. The nurses are now working in so many settings, even if the space nursing has started, the forensic nursing has started, the traveler nursing has started, you can see the nurses are working in the occupational and industries and others. So the future of nursing practice demands a much more stronger workforce to provide care in all the settings. Vision of the future of nursing needs changes as the emergence of new diseases, threat to bioterrorism, new treatment models, and new technologies. Patients are moved out from the hospital soon and need more assistive care at home. Future nurses will be more strong and autonomous practitioners whose practice and care delivery focus much more on health than illness. That is, health promotion is our aim. During the last two days endeavor, you will learn how the nurses contribute to shaping the future of the healthcare delivery, learn about telehealth, revolutionary patient care, artificial intelligence powered healthcare assistance in nursing, integration of patient outcomes, and holistic care for improving patient outcomes, developing skills in cultural diversity. The nurses have to deal with various culture. This is a global now. We have to prepare the nurses at global level. So nurses have to be very sensitive towards the cultural diversity, so that there are now, we know that these are the various new technologies nurses have to prepare for themselves, and these type of webinars and conferences and all will prepare them. And there are certain challenges which we are facing. Now, aging population is one of the challenge. Shortage of nurses result in stress and burnout in nurses. Compromise patient care, it compromise patient care quality, because when shortage of nurses are there, the nurses become overburdened with the work and burnout occurs, and that affects the quality care. Another challenge is related to digital data privacy and security. Electronic health records and telehealth platform hold sensitive patients' data, which the nurses learn for the data protection and maintaining patient confidentiality. This is a very much challenge, for the nurses. All these challenges can be overcome by making nurses to learn about digital technologies in their courses, nurse-patient relationship in future. What will be the nurse-patient relationship with the new technology? Everybody think that maybe nurse-patient relationship and communication will decrease, but no. Digital technology is profoundly altering the nurse-patient relationship by enhancing communication and nurse-patient relationship by patient engagement and transforming healthcare delivery. Electronic health records provide nurses with quick access to the patient information. Telehealth platform will enable ongoing nurse-patient communication. Maintaining a compassionate and patient-centered approach is essential for improving the patient's outcome. Active listening, empathy, and respect cultural competence, shared decision making, clear communication, time and availability with a patient, holistic assessment, patient education, and feedback and follow up and self care of healthcare providers. The self care providers also have to take care of their own health also if they want to provide the holistic care to the patient. Now, these are all the essential ingredients to reach to the future of nurses and to enhance the nurse patient relationship and communication. So, my dear friends, get ready and update yourself and enhance your education level so that you can be a good leader and provide yourself yourself in for front of the healthcare system. With these words, my best wishes to the organizers for organizing this national conference at Gujarat. Jai Hind, Namaskar to everyone. Best wishes, congratulations, everyone. Thank you.
Thank you so much, ma'am.
મેડમ વિમલા કપૂર, મેડમ કુરેશી, મેડમ સુરેન્દ્ર ખન્ના, જોરદાર તાળી થાય એ લોકો માટે. માફ કરજો, હું ભૂલી ગયેલો કે આજે ગુજરાતમાં જેટલા બીએસસી છે ઇગ્નો, એ બધા જ વિમલા કપૂર મેડમને આભારી છે. અને એક સમય તો એવો હતો કે ઇગ્નો વાળાને નહીં લેવાના ઠુમર, બરાબર ને, કે ઇગ્નો બાકાત કરી નાખો, ઇગ્નો એ વેલ્યુ માન્ય નથી. विमला कपूर मैडम के लिए जोरदार ताड़ी हो जाए. મને નથી ખબર કે ઓનલાઈન જોડેલા છે. નવો વિચાર આવ્યો છે. આકાશભાઈ તિવારી અને જયેશભાઈ, તમારે બધાએ મદદ કરવી પડશે. ફાલ્ગુનીબેન, અમદાવાદમાં જેટલા બધા છે તે ગુજરાત નર્સિંગ કાઉન્સિલ મેડમનો વિચાર છે કે જનરલ બહાર પાડીએ દર 3 મહિને, જેથી બધી કોલેજોનું બધું ખ્યાલ આવે. આ જોરદાર વિચાર છે ને એમાં બધાના સહયોગની જરૂર છે. એક આર્ટિકલ કોલેજનો આવે. આકાશભાઈ, તમે બધા અમદાવાદમાં છો, જયેશભાઈ ને બધા, તો મદદ કરજો જેથી ગુજરાતનું નામ રોશન થશે. અને મારી ઈચ્છા એવી ખરી મેડમ, જે રીતે આ લોકો ઓનલાઈન જોડાય તો સામે બેઠેલા પણ ભવિષ્યમાં ઓનલાઈન જોડાય. એટલે તમે સ્પીકર બનો એવી શુભેચ્છાઓ આપું છું.
Thank you so much, sir. All credit goes to Professor Joy Gamadia, sir, who have done all the technical assistance and made this possible. Thank you so much, sir. It's time to felicitate Mr. Ronak Hussain, Registrar, Noble University. For that, I invite Jitendra Jindal, sir, to come forward and felicitate, sir. With great honor, I invite all the respected dignitaries to please come forward and release the first souvenir of the National Conference organized by Noble University in collaboration with National Nursing Scholars Society and NTAI. I request everyone to please come forward and release the souvenir. I request all the committee members also to please come forward as we will be taking a group photograph. All the advisor committee group members, please come forward. Thank you all for doing the honors. Now I request all the respected dignitaries to please take their seats off the dais. We'll be starting our sessions in 5 minutes.
Hello, hello.
Welcome back. Now we are moving forward with the scientific sessions of today. Before that, we would like to felicitate Mr. Amrut Bhai Pokia, Mahatma Gandhi College of Nursing trustee. For that, I invite Mr. Bipin sir to come forward and felicitate sir. Total number of registration from the college was 60 registrations. Thank you so much, sir, for all the support to this institution.
Now, it's time to unfold the theme and begin with our first session. Let us explore the uncharted territories of nursing practice guided by the light of knowledge. For the same, I invite our very respected Dr. Pragna Dabe ma'am, whose presence graces this gathering, infusing it with wisdom and purpose. To do the honors, I invite Professor Falguni Modi ma'am, Principal, Ahmedabad Municipal Corporation, met Nursing College to introduce our esteemed speaker and guest for today's first session to unfold the theme. Over to you, Falguni ma'am.
Very good morning to all the respected dignitaries and delegates. Today, it's a great pleasure for me to introduce the great leader and eminent personality of our nursing profession, Dr. Pragnaben Dabi, Registrar of Gujarat Nursing Council. She has completed the GNM, post-basic base in nursing from the IGNU, MSc Nursing from the Government College of Nursing, Ahmedabad Civil Hospital in Medical Surgical Nursing Specialty. She has completed the PhD Nursing from the Gujarat University. She is the first candidate of the Gujarat University who has completed her PhD Nursing. She has completed the LLB and LLM, and she has the vast professional experience, total 12 years clinical experience, 8 years teaching, and from the since 7 years in Gujarat Nursing Council. So she has a vast experience as a practice nurse, as an educator, as a researcher, and now as a great nursing administrator. As a BA Registrar of Gujarat Nursing Council, she has taken the many initiatives in a GNC, and now she is continue to take that type of the innovation in Gujarat Nursing Council. She has inaugurated the NRTS pilot project in Gujarat and successfully completed the enrollment of nurse under the NRTS in Gujarat. Development of website and online examination system. So after coming here, she start the everything, all the examination in a online, and develop and implement a e-paper system in Gujarat Nursing Council examination. She has taken the initiatives in a e-tablet under the Namo Yojana, and she has introduced the technologically enabled registration certificate with the special security features and motivated the nursing institute and hospital for the CNE. And she has recorded the 100 CNE and conducted the nursing training during the COVID also. So she is the best motivators for the all the hospitals as well as all the nursing colleges. And now in 2020, she received the National Florence Nightingale Awards as a nurse administrator. So congratulations, madam, for getting this awards. So we are inviting the madam to unfold the today's theme. Please come. Welcome, madam.
Thank you for such a nice introduction. The content was not there in slides, even she could able to speak. Great. Thank you. So, good morning. First of all, I would like to congratulate Nursing Teachers Association of India, NSS, and Noble Nursing College. Entire team did a great effort to make this conference successful one. The topic, which is really need of an era, and I think this group, all participants will learn many things from this conference. All of you are knowing about the topic. And one more thing I would like to share with you that I'm good listener. So I will listen more and speak less. So let us have some discussion. Okay. All of us know about the topic is on futuristic nursing. Futuristic nursing means what? Means what will be the nursing in future. Okay. Whenever we talk about the future, what we think, from where future is coming. First is from the need. Okay. What is the need? According to that, our future is that. What are the challenges? What are the development? What are the changes? These all factors are affecting for our future aspects. All of you are in the nursing profession. Many of you are teachers. Many of you are in admin. Many of you are students. So my question is to all of you that according to you, what is your desire for nursing profession? So this question is for you. What is your desire? Okay, whenever desire is there, whenever dream is there, absolutely future is there. There should be vision also. If our vision is good, we will achieve the goal. So my question is for you. What is your desire? What is your dream for nursing profession? We must be loved as a human being, as a nurse also. And how we can become live? By dreaming, by planning, by having vision, by speaking. Okay. So I encourage you, all of you, to be a leader, to be a good nurse, to be a good futuristic nurse, to be a dreamer, to be a planner. So what is your dream? Let's forget about everything. Forget about the telemedicine, forget about AI, forget about robotic surgery, everything. It is there. But what is your dream as a nurse? How nursing should be? Okay, forget about dream. If you can't speak about dream, tell me about what are the challenges. What is your pain? Tell me about that. That pain may lead to, have a dream. That can be also possible. If you can't trip, then share your pain. What do you think how nursing profession should be? Any one of you can speak anything. It is not a theoretical question. It is a practical question. Okay. What is your insight? What is your vision about profession? Are you comfortable with all the things? What is going on? Or you want some change? You want any change in nursing profession? Yes or no? Chalo, simple question, very simple question. Yes or no? You want? Yes. Good. At least you spoke yes. Okay. So if yes, then let us discuss what is there in this yes. What kind of changes you want? Why you are not comfortable? Let's enjoy. This is our family. This is nursing profession. All of familiar members are there. We will discuss. We will solve the problem. And yes, definitely our future will be bright. If we discuss, if we share, if we ask, then there will be solution. And nursing profession will be at the state of the art if we discuss, if we speak. Otherwise, not. Are you agree with me? Then tell me. Second mic. Yes, excellent. One mic.
Just I want to say, ma'am,
Yes.
whenever we are working in the clinical areas, so there should be a shortage of staff. So because of shortage of staff, we cannot give the quality care to the patient.
Okay.
So definitely, maybe it should be there.
Excellent. So one is the shortage of staff. So we need more nurses to be trained. We need more nurses to be recruited. And
That
strong
should be a
policies
maintain,
are
like
there.
ratio
Yes,
should be
nurse-patient
mentioned.
ratio should be maintained. Excellent. One thing is that shortage of staff. Yes, please have seat. Anything else?
Thank you, ma'am.
Your pain? Yes, excellent.
Good morning, ma'am. Morning, all of you. There is another thing. There are so many technological advances in the nursing areas and teaching education also, simulation-based practices and mannequins, all are, and teachers require specialized training for
Excellent. Yes.
technological advances.
Okay, so there are many technological advancement in healthcare system. Our teachers should be trained. Our students should be trained. That's very good. Anything else? Yes, how's it? Anything else? Your pain is a good platform to speak, you know. Okay, now what is your dream? All of you are somewhere in nursing profession, okay? Some of our students, some are teachers, some are administrators. But dreams are dreams. I have also dream. First, let me tell your dream. Then I will tell you my dreams. Okay. So, what is your dream? All of us are alive. Then alive persons must have dream. What is your dream? We are here to solve problems. We are here to have a vision. We are here to have a dream. Okay, because we are talking about futuristic nursing. When we say future, future is plan, future is vision, future is dream. Agree? Then what is your dream? If we don't know our dream, if we don't know our goal, if we don't have vision, then how can we talk about future? We can't talk. Can we? Yes, please.
My dream is to change the student mindset because student thinking nursing is like school. We have no time for enjoyment, no scope for enjoyment. I want to give mindset that nursing is like an enjoyment only. If you give interest in nursing, you can use AI, you can make reels, you can make videos of nursing procedures and all. So you can interest in, so you can enjoy your life.
Okay, so that is your dream to change mindset of our students. So how students' mindset can be changed? Answer. How? Okay, one thing is motivation. I think students can give best answer of this question. What they need to make their future bright. What is their desire? Student. Open platform.
Student budget or student?
બોલવામાં કોઈ ફાંસીની સજાની જોગવાઈ હોતી નથી હા બોલી લેવાનું યસ મસ્ત આવશે હા
Good morning, ma'am.
Very good morning.
The most important thing is all the students should learn about the quality nursing care. Because nowadays we see in the small clinical areas, all are wishing to become the staff nurse and going to AIMS. But the more important thing is nursing is not about just having a high position. Nursing is about care. If we are wishing for care, then I wish that all the nurse should have the equal respect, not just nursing officers or staff nurse, but nurses working at the clinical areas. So clinical area needs a quality nursing care, and all the students should be provided the education related to clinical nursing care, and all the teachers should be also that much compatible to give the clinical nursing care.
Excellent.
Which is a qualitable and which is advanced.
Okay. Good. If we are thorough with knowledge, if we are good in skill, then we will have a confidence and we can provide nursing care with confidence without any hesitation. And it will motivate us to provide nursing care. Good. Anyone else from students? What do you want? So, ma'am said that the students' mindset should be changed. Okay. It is not a burdensome. to learn, to provide nursing care. So something different should be there. So as per your view, what kind of changes should be there in teaching? What do you feel? Anyone? Student? One aspect of this conference is leadership also. So how you can become a leader? By speaking, by having assertiveness. Okay, what is right? You are able to speak in a good way. That is a quality of leader. So if you want to become a leader, just share your views. This is a practical session, not theoretical session. What is your wish? How you can be a better nurse? So your future will be bright. What is your view about nursing profession? No vision, no idea? Whatever comes in your mind. Okay, whenever you go in clinical side, what do you feel? You feel dependency or you feel independence? Loudly. Dependency. Okay, so dependency. Okay, that that is a factor to stop our growth. That is one is dependency. So in future, what we want? Independency. So that's why independent nurse practitioner, okay, can in existence. Now we are having a independent nurse practitioner courses. We are on the path. Okay, so in future, our role will be somehow, somewhere, in some aspect, independent. Okay, now we are feeling that our role is dependent. So we can't grow. That is a one. Okay. One more thing. Whenever you go in the clinic, what do you feel when any advanced machinery is there, any new diseases is there? So how do you feel? Do you feel that you are competent enough to operate those machines, to interpret those machinery data? Yes or no? How many years? How many no? No, 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 yes, no, no. See, this is practical. You can't speak even. You don't have your opinion even. No, no opinion. Yes, no opinion. Then where we are? Are you getting me? Okay. So first, we must be clear from our side what we want, what is our opinion, what we think, what is there in our mind. Okay, if you can't speak, then there will be no future of nurses. First, we need to think. Then we need to analyze whether we are thinking it is right or wrong. Then we will need to take experts' opinion. Then we will have a plan. Then we will have a vision. Then we will have a dream. Okay, so again, are you comfortable when there is a new technology is there? For say, telemedicine is there. Okay, are you comfortable with the telemedicine concept? Will you be able to work with telemedicine concept on very first day? Yes or no? How many no? How many years? No, yes. Okay, थोड़ा बहुत तो changes था. So, do you think your syllabus enable you to, be skillful in telemedicine? Yes or no? Yes or no? Are you? Okay, from very next day, for say, after completion of your course, you will have an opportunity to work in digital field, to work in, for say, telemedicine. Okay. So all of you are saying that you are okay. Okay, how? Who will tell me what is telemedicine and how it works? Hmm? Okay, Okay, so you are not able to speak about telemedicine. What is telemedicine? Then how you will be, have a skill to work as a nursing professional in telemedicine? You got my point. I'm here to open your eyes, nothing else. Okay, are you getting me? Okay, if we don't know what is the question, then how there will be the answer? Okay. In our inaugural session, K sir has explained about different diseases and all, and at the time of Corona, how mistakes we did, and majority of work is done by nursing staffs and other technicians. And WHO also have noticed significant importance of nursing during COVID era. So 2020 and 19, where for nurses and midwifery the year was declared. Okay, so this was the significance of nursing. So when this kind of pandemic are there, are we able to provide skillful care? Do we have that kind of knowledge? Because now world is a global village. Okay, so we should be at par with globe. So do you think that you are, capable enough? Yes or no? What are the? No. Okay, where from? So this is a challenge. This is a need where dream starts. Okay, so your dream must be, you should be capable enough for providing care at a national and international level. Okay, are you getting my point? Okay, so many new concepts are there in nursing profession. One of that is there in our conference topic, that is OSCE. Do you know about OSCE? Anyone? Have you gone through with the topics? So that type of curiosity must be there. Whenever we are going to any conference, any seminar, so what is there? We must read. We must have question. At least what is the concept? That knowledge we must bring before coming in the any seminar, any conference. Agreed? Okay, so you don't know about the OSCE? Yes or no? No. How many years? Okay. Yes, ma'am. Up. Mic.
OSCE is a objective structure clinical examination. There will be a 7, 8, 9, 10 stations will be there. One question will be asked and student have to show the steps of procedure in each station.
Okay.
For that.
Why OSCE is important?
Because OSCE gives competency. It shows this person is knows the what are the procedure and what are the steps, so that when he or she goes in clinics, he is able to give competency based care to the patients. It shows that.
Okay. Through OSCE, we are conducting practical examination. Okay, one thing is that. So how this examination is different from this our routine examination technique at present, whatever we are conducting?
One important difference is that in currently we are conducting practical examination with live patients. In OSCE, we shows perfect each steps students knows or not. We are seeing that student follow steps or not.
Excellent. Anyone want to add anything? Has anyone? Anyone? What is the importance of OSCE?
Good afternoon, madam.
Hi.
Madam, ASCII is strongly indicate the students are students are strongly involved in the clinical practice. So in nowadays, the modular examination and ASCIIs are added in the according to the Indian Gujarat Nursing Council. So this is a very useful in madam. Completely the students are ready for the practical and as well as theory examination.
Excellent. Okay, so this is a new concept for gaining practical knowledge. Yes, sir.
Yes, madam. Specifically, objective structure clinical examinations is based on the clinic area. And skill is very much important when you are giving the comprehensive care to the patients. And in the final examination, also Gujarat Nursing Council accept the OSCE in the final unit examinations. So students know whatever procedures is done in the specifically in the nursing foundation lab, and also after completion of the nursing foundation procedures, we are placing all students in the clinic area, and we are observing the patients, and due to that reasons the students, all students, they get the detailed knowledge related to the practice and related to the procedures. So this much is very much important, and due to that reasons the GNC is established the new examinations theory, means new examination practical examinations. Okay, thank you.
Excellent. So this is for development of skill among student. Okay, so that is a OSCE examination. One more thing is involvement of nursing professional in decision making. If we talk about the futuristic nursing, why involvement of nursing personnel in policy making is required? What is the need? What we faced? So we think that yes, there must be a involvement in decision making of nursing personnel in the policy making. I think teachers group can give answer of that. Anyone? Yes.
There are two main reasons કે પોલિસી મેકિંગમાં નર્સિસનો રોલ હોવો જોઈએ. ફર્સ્ટ રીઝન જે તમે કીધું હોય કે ડિપેન્ડન્સી. ફર્સ્ટ રીઝન એ છે કે ડિપેન્ડન્સી ઘટાડી શકાય જો નર્સિસનો રોલ હોય તો. અને સેકન્ડ રીઝન, જે વ્યક્તિ જે ફિલ્ડનું છે, જે એરિયાનું છે, એ જ પોલિસી મેકિંગ કરે તો એ બેટર પોલિસી મેકિંગ થાય. આ બે મેઇન રીઝન હું બિલીવ કરું છું.
Excellent. So nurses are giving care. There is a first-hand care. So she knows much better than others. Okay, in healthcare system, because she is 24/7 available with patient. First-hand care is given by nurses. So nurses know much about the healthcare system. So if there is an involvement of nurses in policy making, then many problems of healthcare delivery system can be solved. That is another thing. Okay. So we are facing many challenges in this era. We are having many opportunities. Okay, when there are opportunities, I say challenges are there. At present, we are having many opportunities. Okay. Yes, our society is nowadays giving importance to nurses. Before that, it was not there. Okay. One more thing, that we don't have enough number of doctors, so we can provide care to each and every person. So many nursing personnel will will get training in specific areas, and then they can provide independent services to the client. Okay, in Gujarat we are having a nurse practitioner in midwifery course. Okay, so there is a midwifery led care unit. Adjacent to that, gynecologist led care unit is there. So if there is a normal delivery, then midwife can conduct independently. If there is any deviation, they can refer the mother. Okay, so this is a new concept and it is there in our system. Okay. Then nowadays many chronic diseases are there. Age limit is increasing, so many geriatric persons are there in our community. So we must develop accordingly. We must learn geriatric nursing. Okay, genetics are there. There are many genetics problems in our society. So we must learn about genetics. So what is the need of healthcare delivery system in our community, in our society? According to that, we have to develop. Okay. And I agree with Madam that she said there should be change in mindset. Okay, if we feel that nursing profession is burdensome and it is boring, then we can't learn anything. Okay, with God's blessing, we are here in this noble profession. And with His blessing also, we are here in Noble University. Okay, so we must take interest and we have to work by heart for our profession. Okay, it is not that one person can make change. We must unite and then we can make change for our profession. So dream big for yourself, dream big for nursing profession, and we can have a bright future for nursing. So start dreaming, start planning as per your dream, and bring our profession at the state of art. This is my message for all of you. Okay, so to bring change, you must have a knowledge, you must have a good attitude, you must have a good plan, good vision, good dream, and after that you have to implement those strategies. Okay, so all the best. If any questions you can ask. And through this seminar, I can say that I have a hope that many discussion will be there and we will have a big dream for futuristic nursing. We will have a plan and we will work accordingly. So that is my dream. I said that you tell your dream, at the end I will say my dream. So my dream is this. And I hope that there will be a lot of support from you. Yes or no? Okay. So all the best for bright future. And thank you all of you. If you have any question, if you want to share anything, if you want to speak anything, you are free to speak. Okay. So it is one good characteristics to speak. Without speaking, we can't get anything in this world. But speak in a nice way. So no questions, no sharing. Okay. Thank you for patient listening. Thank you all of you. Thank you.
Thank you, madam. Today, madam has discussed with the nursing students delegates with their challenges of our profession and their dreams. I think future of the nursing is always depend on the dream of the nursing students. And this dreams is reflect our nursing futures. So we are heartily thankful to madam for a very excellent way unfolding this today's theme. Thank you so much.
Thank you, ma'am, for the insightful address on futuristic approach toward nursing practice. Now, I request Falguni madam to felicitate our speaker with token of respect and gratitude. I invite Mr. Dakshesh Patel to felicitate Professor Falguni Modi madam with respect and gratitude. Heartfelt thanks, madam, for the wonderful session. Thank you, ma'am. Thank you so much.
Thank you so much, ma'am, for the wonderful session. Let us glide onto our second session, which is on nursing future in digital age. To conduct the session, I invite Professor Dr. Lakshmi Priya Das, Principal at Balaji Nursing College, Gondal, to moderate and introduce the speaker of our session. I humbly invite Professor Dr. Lakshmi Priya Das to please come onto the stage and carry forward the session. Over to you, ma'am.
Good afternoon, all dignitaries and delegates. Professor Jayesh Jain is an eminent speaker. He is the principal of GCS School and College of Nursing, Ahmedabad. He has been working since 10th September 2015 to till date. About his professional qualification, he has completed BSc Nursing from Jiwaji University, Gwalior, Madhya Pradesh in the year of 2006. He has completed his MSc Nursing in Medical Surgical Nursing specialty. He is pursuing PhD Nursing. About his clinical experience, he has worked Chitram Hospital and Research Center, Indore, Madhya Pradesh for 1 to 4 years as a nursing staff in ICU, cath lab, male medicine ward and male surgical ward. About his teaching experience, he has worked at Sri Dadu Dayal School of Nursing, Jodhpur, Rajasthan as a assistant lecturer for 7 months. Then he has worked at Bina Singhi College of Nursing, Hansol, Ahmedabad as a lecturer for 5.2 years from 17 July 2010 to 8th September 2015. About his publication and paper presentation, he is the author of Child Health Nursing Practical Record Book, which is published by J.P. Brother. He has presented his scientific paper in national and international conferences. About his publication, he has published papers in the nursing journals. About his awards, he has been awarded for writing, photography, best player for volleyball in Spectrum 2010, quiz, face and poster painting competition, and he has got Rajyapal Award at state level scouting at Rajasthan. He is also an examiner and paper setter at various universities. Now I would like to request to Professor Jayesh Jain to tell you in detail about nursing future in the digital age. Welcome, sir.
Very good afternoon, one and all. Thank you, madam, for introduction. Do you know who is this? Who is this? Speak loudly. Remo D'Souza is an actor, film director, film writer, and choreographer. He has a very big connection with today's session. Just couple of months back, he was in gym and he was having cardiac arrest. Nobody was near him and he was just saved because of digitization and artificial intelligence. He wear Apple Watch. Nobody was near him. The watch sense that he is having cardiac arrest. That sense sent to his wife. His wife called to the gym owner and coach, and they reached to Remo D'Souza and they admitted him to hospital. Now he's okay. So this is what the power of digitization, right? Next slide. Just if I talk 100 year back, my grandfather was studied below the tree. My father studied in classrooms. I studied in lecture halls with internet facility. Now my son is studying with digital boards and artificial intelligence. This is what the power of digitization. If you just see 50 years back in clinical settings, we have to write each and every notes with hands on paper. Even just 10 year or 15 year back, it was in the practice. But now we have the tablets, tablets, telephones, EHRMS facility, each and everything. We have to enter the data of the patient from admission to discharge, test, blood report, X-ray report, CT scan, everything is on one platform, right? So each and everybody can see all the details of a patient on one time. That is the power of digitization. Next slide. The virtual nursing is rapidly growing area of healthcare that utilizes technology to deliver nursing services remotely and support from frontline nursing staff. Additionally, virtual nursing enhances the nursing profession by providing opportunity for nurses to develop new skills and work in innovative ways. Next slide. Let's see the historical view. Before the advent of modern technology, as I spoke you, that just before 10 or 15 years back, if you see the clinical setting, we have to work manually. Now everything is on EHRMS platform, or we can write whatever we want regarding the patients online so that each and everybody can see. Next slide. Next slide. The evolution of nursing in the digital age. The field of nursing has seen significant advancement and changes in recent years. One of the key drives of the evolution of nursing in the digital age is increased focus of data-driven healthcare. So just 10 or 15 years back, if you want the data of the patient for last 10 or 15 days, so we have to see all the pages, whatever you have written in the patient's file. But now what you have to do, you have to put the filters in each RMS and you can see the comparison of each and every days. Next slide. Next slide. Next. Back last slide. Let's see the impact of technology on nursing. Technology has had a profound impact on the practice of the nursing. Next slide. So there are some key impact of technology in nursing profession, in clinical as well as in education side. One of the key impact of technology on nursing is the increased efficiency and accuracy of patient care. If you have the exact comparative data of any patient for last 10 or 15 days, so you have the accurate data. On the basis of that, you can give the excellent care and you can compare the patient progression. As per that, we can manage the line of treatment. Additionally, technology has enabled nurses to automate routine tasks such as medication administration and vital signs monitoring, freeing up time to focus on more complex and critical aspect of patient care. If we go through the paperwork, so what you have to do is कि डॉक्टर्स ने आज कंटिन्यू लिखा कि नहीं लिखा है, कितना मेडिकेशन बीडी ओडी टीडीएस या फोर टाइमर डेज देना है, राइट? बट इफ यू हैव द artificial intelligence as well as digitization, so you need not to worry about the computer or the system will send you the messages, sister or nurse, you have to give this medication on this time. Next. Another important impact of technology on nursing is improvement of patient outcome and safety. That I spoke to you that Remo D'Souza nurses now have access to data analytics and artificial intelligence tools that help them identify the patterns, trend and potential risk in patient care. As I told you that if you have the comparative data so that you can compare that day one the patient is having this level of the sign and symptoms. After giving this medication, day 3 it has been reduced or it is not improving, so that you can decide that what type of line of treatment has to be given to the patients. Next slide. Technology has also revolutionized the way nurses communicate with patients and collaborate with other healthcare professionals. With the rise of telehealth services and securing messaging platform, nurses can now provide care to patients remotely. In remote area, if you have seen the time of the COVID, so there was, in initial, there was no treatment. In remote area, people are not aware. So with the help of telemedicine, telehealth services, the doctors from other place, they are giving the instruction to the patients of COVID for the treatments. Expanding access to healthcare services and promoting patient engagement. The virtual communication also allows nurses to consult with physicians, specialists, and other members of the healthcare team in real time. So this kind of telemedicine prevent your time, reduce the time of treatment, so the patient will get more effective treatment and patient will be. The example of communication technology are WhatsApp, chatbots. Nowadays we are using messaging application and website by which we can give the message to the patient from one place to remote area. Next slide. Okay, this is the heart of the today's presentation: digital tools and technology in nursing. Next slide. Let's see the power of digitization in nursing education. Next slide. Just imagine a word. Just imagine a word where if you are working in a hospital and you want to pursue any degree, but you don't have time to visit the college regularly, and if any council, they are launching any kind of course which is online, how it would be? How it would be? Is it possible to continue to pursue a degree with your current job? Yes or no? Online. It is easy, but if it is offline, then it is very hard for everybody. कि job छोड़ के कौन offline courses करने जाएगा, right? But if it is online, then it would be easy. If classes come to you, if teachers comes to you, expert comes to you to teach the theory as well as the clinical skills. Let's see. Next slide. The key feature of online nursing programs are they are designed with the modern learner in minds. It is interactive coursework, real-time collaboration with peers and faculty, and multimedia resource enrich the learning experience. If you read something, you will remember a little bit. If you see something practically or on video, you will remember all. While the idea of online study can be daunting, the platform are user-friendly, making technology a facilitator rather than a barrier. Further, these programs are often tailored to meet individual student diverse learning styles and paces, ensuring the everyone can thrive. Next slide. The important thing to run an online course is the accreditation, to maintain the ethics, the maintain the rule that how this online course will be there. If we are pursuing any online course like Operation Theater Techniques, if we are pursuing online course like Operation Theater Techniques, so you will learn the theoretical anyhow, but how will you learn the practical? It is a challenge. So this challenge will be maintained by the accreditation like Indian Nursing Council, Gujarat Nursing Council, or any university if they are providing any criteria that how to give practical knowledge online. So this is the one concern. Next. Next slide. Navigating online courses and interactive learning tools, embracing the digital trend. Online nursing program leverage innovative tools to deliver course material, engaging video lectures, which is important, interactive simulation, and virtual group discussion replicate the in-person experience. So these are the key features while we are going for the online courses. Even clinical skill can be practiced through cutting edge simulation software like VR. Have you heard about VR? What is that? Virtual reality. In that, what we have to do is we have to wear the glass, right? And you can see the clinical procedures in that. And you find that you are involved in. The second technology is called as augmented reality. What is that? Augmented reality, in that you find yourself in the system and you can perform the procedure and you can learn the skills. Next slide. Overcoming common obstacle faced by the online nursing student. There are some obstacles also. Studying online might trigger feeling of isolation for some, but leading program work to mitigate this by fostering a robust virtual community. Time management is the another test. If you have class at 8 p.m. and you are supposed to leave 2 to 8 p.m. evening shift. So what is your problem? Your problem is the time management. So during online course, your obstacle is the time management, the how to start classes on 8 p.m. sharp, because you have to punch 8 p.m. and you have to start the class 8 p.m. at house. So it is little bit tough. However, by setting a regular study schedule and engaging with fellow students and instructors, these challenges can be effectively addressed, allowing for a fulfilling educational experience. So in that case, if you are not able to manage the time, so you have the video for the post classes. Next slide. The impact of technology on nursing education and practice. Healthcare is no stranger to technological advancement, and education is following suit. With a surge in health tech solution, nurses must be tech savvy to meet the demands of modern healthcare setting. So nurses should be tech savvy. They should be friendly to the technology. Innovative teaching method in virtual learning environment. Aside from interactive lectures and simulation, online nursing programs incorporate other innovative teaching methods. Virtual case studies should be there. Peer assessment and real world problem solving activities are all part of the curriculum. Next slide. This is the heart of the online courses, that is simulation and virtual labs. Nowadays we have in our system. It should be added to the curriculum. As of now, the virtual labs are not part of our curriculum, but I hope as per the demand time, it will be there. But in foreign countries, it is there. Hands-on clinical experience is a cornerstone for any nursing professional. Hands-on practice, it means whenever we are in the labs, so our teachers teach us the skills like bed making or whatever the number of procedures, right? We have to stand beside the bed and our teacher is teaching us live. But if you want the online courses, that time we have to be virtual labs. Student can practice complex procedure and critical thinking without immediate risk. Building confidence and competence before entering real world clinical setting, the answer is artificial intelligence. So day one, I will explain, share my experience with you. I was in Maharani Lakshmibai Medical College, Jhansi. So day one, in first year, we were posted to the male medical ward. One of my friend was instructed by nurse, just go and give this injection to this patient, IM. So it was his first experience. So he went with the tray, he inserted the IM injection on buttocks and he leave it just because of fear. So injection was dancing like this. Just think about if that time we had the simulation expert labs. So what we learn? So practice will be more, and that incident should not be there, but it was there, right? So if we learn on simulation or in virtual labs, so our confidence and competency will be increased for nursing procedures. Next slide. So this was the power of digitization in the education side. So let's see the power of digitization in clinical side. Next slide. Next slide. Let's see the digital tools and technologies in clinical nursing. Do you have any idea about any kind of tools which make easy our nurses' works? Any digital tool, any kind of, any artificial intelligence tools, if you have seen? Yes. Mic share करो ना please. Hello. Okay, after discharge, if you want to see the patient blood pressure online.
ऑनलाइन नहीं हो क्लिनिकल साइड नहीं बात
हाँ, क्लिनिकली बोल रहा हूँ मैं. पेशेंट हमारे से डिस्चार्ज हो गया, ठीक है. कोई हाइपरटेंशन पेशेंट है, कार्डियक अरेस्ट का पेशेंट है, ठीक है. अभी नाउ व्हाट यू हैव टू डू इज कि उसका एवरी आवर यू हैव टू check the blood pressure. Now, what is your choice?
સો એને ઓનલાઈન બ્લડ પ્રેશર માટે આપણે જે કંઈ બી ટીપીઆર માટે મેન્ટેન કરવાનું છે આપણે એને શીખવાડી આપીએ મતલબ ટ્રેનિંગ આપી શકીએ છીએ એને.
See, there are some gadgets. If you wear, so same information will be shared to the nurses and doctors. So that is the power of digitization as well as artificial intelligence. Let's see. Next slide. When I was working in Choitram Hospital 2006 to 2008, so when patient comes to us, we ship to the patient, we call to the doctors, we have to write the admission notes. So and so patient admitted under so and so doctor with so and so complaint, with so and so TPR, or whatever the sign symptoms, right? Then doctors comes, he write all the medication, blood reports we have to send to the servant with the blood cheat. कि भाई ये blood report तुमको करवाना, just call to the laboratory specialist. So he came, X-ray machine came and everything. Now scenario has been changed. 2006, now we are in 2024. Just after 2010, the EHRMS system has been developed in some of the hospital. Now EHRMS system is developed in each and every hospitals. So nothing you have to write, you have to just enter the data on electronic health record management system. Have you seen? Anybody have seen EHRMS? It is a software which is present in the computers in your ward. So when patient comes, we have to maintain the file, but all the data is get together in the system. Electronic Health Record Management System or EHRMS have transformed the way patient information is documented, as I said, stored and accessed. Gone are the days of paper charts and handwritten notes. EHRMS allow nurses to access a patient complete medical history at the click of a button. With EHR, nurses can quickly and easily track a patient vital signs, medication history, lab results, treatment plan. So this streamlined access to information enables nurses to make informed decision quickly, improving quality of care provided of patient. If you have the history from day 1 to till discharge, so you can compare from day 1 to till discharge. And if you need to improve any line of treatment, or if you want to give any special nursing care or medical care or any special surgery, so by the comparing the everyday report, you can decide whatever the treatment you want to give. So this is the power of this EHRMS. In addition, EHRMS facilitate communicate and collaboration among healthcare providers. Nurses can easily share information with doctors, specialists, and other members of the care team, ensuring that everyone is on the same page when it comes to the patient treatment plan. Even nowadays, when patient is discharged, some of the hospital have a software, they give a special registration number. If they, after discharging or after discharging of 1 month, 2 months, 1 year, 10 years, if they want the previous data, so what they have to do is with the registration number, they have to visit that hospital. I think Apollo Hospital, Ahmedabad have this facility since it start. So if you put that registration number, you have all the data. Have you heard about ABBA card? Nowadays it is in trending, right? ABBA card is the same process. So once you have the ABBA number, so when you are admitting, even you are going to any OPD, that all the reports, all the OPD description or whatever the treatment is given by the doctors to you, it's each and everything will be on the ABBA website, right? So if you want to see any data of your previous life regarding your health, you will have the on one platform, that is ABBA, right? How many of you have ABBA card? I think 3 or 4. Please, ABBA card बनवा लेना. Next slide. The second one is telemedicine and telehealth. Telehealth and telemedicine have become essential tools in the digital age, especially in the wake of COVID-19 pandemic. This technology enables nurses to provide care to the patients remotely, which help reducing the need for in-person visits and minimizing the rise of exposure to infectious disease. So when I was in BSc nursing or MSc nursing, there was a topic telemedicine, telehealth, but there was no practical. But when COVID comes, so everybody was aware about telemedicine. If you are calling to your parents or your friends during COVID, कि भाई लेमन जूस ले लेना, राइट, विटामिन सी ले लेना, और कौन सा मेडिसिन था, एजिथ्रोमाइसिन ले लेना. So that is also part of telemedicine. It doesn't require any expertise, but you must be expertise whatever suggestion you are given to your next beloved. Through telehealth platform, nurses can conduct virtual consultation, monitor patient vital signs, and provide education and support to individual managing chronic condition. Nowadays, there is one technology which is called as impression. It is useful for the telemedicines. If you have the mobile and the other person is on mobile or online, so what the doctors is do during telemedicine, they open the software on the system, both can see. If I want to see the vital signs, the person has to put his finger on the system. See, if Akash sir is doctor and I'm the patient, so if he's giving telemedicine to me and he want to see my vital signs, so what he's doing is he will be open the software. This software will be project to my mobile. So what I have to do is I have to put my fingers and sir will get all the vital signs, temperature, pulse, respiration, BP, and oxygen. So this is now is under construction. So under development, soon it will be launched. So this is the power of telemedicine and telehealth. Telehealth and telemedicine have also proven to be valuable tools for triaging patient, reducing emergency room visit, and improving overall healthcare outcomes. So during COVID, you have seen that hotels are equipped for the patients, right? So there was a TV and patients are in hotels, doctors are in their place in hospital or their home. So whenever the treatment has to be given, so doctors will only call to the video through video calling. They will ask, what is what medication have you taken? What was your temperature? Right? Have you seen that? How many of you have worked during COVID? Okay. Next slide. This is the important, that is wearable technologies and mobile health apps. Have you ever heard about wearable technologies? What is wearable technologies? The technologies which you can wear, which helps to monitor your physiological data or parameters, and that has to be sent direct to the next connecting systems. And mobile health apps. आपने कभी ऐसा कोई एप्लीकेशन डाउनलोड किया है कि हम इतना वॉक करेंगे, इतने इतने महीने वॉक करेंगे, 10,000 20,000 वॉक करेंगे स्टेप्स, हम चढ़ेंगे तो हमको कुछ रिवॉर्ड मिलेंगे, अवार्ड मिलेंगे, पैसा मिलेगा, गिफ्ट मिलेगा? हैव यू हर्ड अबाउट? किसी ने किया है? सबने किया होगा. दैट इज सी wearable technology and mobile health apps are shaping the future of nursing care by empowering patients to take an active role in managing their health, from fitness tracker to a smartwatch. Have you heard about fitness tracker? Fitbit. है Fitbit सबके पास? Right. Smartwatches which can read your heartbeat, temperature also. This device collect real-time data on a patient activity level, heart rate, even sleep pattern, oxygen level, and other parameter also. Nurses can use this data to gain valuable insight into a patient overall health and well-being. By analyzing trend and patterns, nurses can identify potential issues, track progress towards health goals, and provide personalized recommendation for lifestyle changes. Mobile health apps also play a crucial role in promoting patient engagement and adherence to treatment plans. Okay, what you do if in class your teacher will ask, this is the term, what is the meaning? If your teacher will ask, this is one term, what is the meaning of the term? What will you do? The front bencher will open the book, dictionary. What will the last bencher? They'll open the Google. Or they will have the Oxford dictionary or medical dictionary. Or last bencher will answer at first. जबकि उसको पता भी नहीं है. Right? So that is the power of digitization. By incorporate wearable technology and mobile health app into their practice, nurses can enhance the patient experience, improve health outcomes, and foster a sense of empowerment and autonomy among individuals seeking care. Let's see next slide. There are a number of wearable technology and mobile apps. There are some mobile app which I will give you. If you want to have some information management, you can use Evernote, Notability. If you want to see the PDF viewer, this is what we have, everybody's mobile. If you want to collect the information and if you want to put it or storage in your cloud space, then you can use Box, Dropbox, and Google Drive. I hope everybody have Google Drive. What is the limit of Google Drive in your mobile? Free space. कितना है? 15 GB. Correct. If you want reference and information gathering, you can use Epocrates, Dynamed, Skycap, Omnio, and Dynamed for the drug reference. Up to date, Medscape, John Hopkins Antibiotic Guide, Sanford Guide to Antimicrobial Therapy, MedPest Today. So these are for the medical reference. Next slide. For communication and consulting. For communication consulting nowadays, which application is best? Which everybody has. कौन सा है? WhatsApp दूसरा? Instagram. अभी सभी ने अपने सिस्टम में अपडेट किया ना Instagram कि हम लोग नोबल में हैं अभी, right? That you are communicating, right? So you can use Doximity. It is a social networking for MDs as well as for nurses. If you want to manage the patient and monitoring them, we have Diagnosis, Pocket Lab, Lab Pro, Archimedes, MedCalc, Medication, Calculate. So these are the medical calculator. Medical calculator, it is especially used in pediatric as well as in ICU, OT, and cath lab or emergency. Or if you want, sometimes in the general wards. For nursing education and training, NCBN, NCLEX RN Mastery, NCLEX RN Pocket Prepare, NCLEX RN Question and Answer, Nursing Clinical Mastery. Nowadays, CBS Publisher has published their software. Have you seen? Have you seen CBS Publisher का जो software आया अभी? In that you can see number of procedures, number of education material, number of report, grading and everything. Next slide. Okay. Now this is the main topic, that wearable technologies for healthcare professionals. The first one is smartwatches and fitness tracker. So the smartwatch that I have given you example of Remo D'Souza. Even Apple Watch give you the sense if there is a prone for the earthquake. Have you heard about? You just Google and just see what are the features of that Google Apple Watch. These devices can track your vital signs like heart rate, activity level, sleep pattern. Healthcare professional can use them to monitor patient remotely, track their own fitness and health, and receive alert for any abnormal vital signs. So this was the only uh, wearable smartwatch which helped that Remo D'Souza. Wearable ECG monitors. See nowadays, if a patient comes to you with heart failure in your hospital, you treat him and you discharge him, right? Now what you have to do is you want to assess for next 7 days ECG reading. So what will you do? You call every day? Is it possible? So in that condition, we have to give a ECG wearable watch or any device. The number of devices are available. So the patient can wear on the body and every time or whatever the time interval we set, it read the ECG and it's sent to the doctor or nurses. Smart clothing. Have you heard about smart clothing? No. Let's see. Cloth embedded with sensors can monitor your physiological parameters such as body temperature, respiratory rate, and posture. This data can help healthcare professional in remote patient monitoring and early detection of health issues. So it is kind of jacket. If you wear and you start it senses, it sense your body physiological parameters. Wearable blood pressure monitors. This also monitor your blood pressure and vital signs. Wearable glucose monitor. This is useful to check the glucose level on some special time intervals. Next slide. Smart glasses. This wearable devices equipped with augmented reality. Technology can provide healthcare professional in real-time access to patient data, which doctors have to wear the glass, right? So during surgery, if you want to see the patient specific data, so nothing you have to ask, just you have to blink the eyes and it will gives the data on your glass. Now it is under development. Wearable cameras, body worn cameras can be used by healthcare professional to capture patient encounter, surgery or procedure for documentation, training or quality improvement purposes. Wearable stress monitor, this system can monitor your stress. Wearable sleep trackers. Many of the patients have apnea during the night. So that time if the patient wear the sleep trackers on head so that we can assess the sleep pattern of the patient. Next slide. So these are the pictures of wearable technologies. Next slide. Okay, next slide. Since first you can see the pulse oximeter, it is kind of ring. If patient discharge, patient want to check their pulse oximeter, pulse, they can wear the ring and it will read the pulse and it will send to the doctors or concerned personality. Next. The next is sleep tracker. See, this is the sleep tracker which you can assess your sleep pattern during your sleep. This is the wearable cloth. As I explained you, this is kind of a jacket which can assess your oxygen level, blood pressure, skin temperature, your activity level, your heart rate, your respiration, overall your physiological parameters. Next slide. This is the VR technology as we have discussed. Can we open this video? YouTube link. Copy this link. Next slide. Escape करो उसको, escape करो, escape it. Escape. Okay, copy it. Copy the link. Open YouTube. Put it here.
Involved with today is really
This is the
exciting. We
VR
did a
technology.
virtual
Students are
reality,
learning the skills
where the
in the
program
lab.
allowed us to practice a pap smear, which is a very sensitive procedure and screening that's so important.
The
in
device which is in a hand, it is called as a
across the spectrum, not only in
remote.
nursing, but especially here in School of Nursing, have similar struggles where they don't get enough patient experience in the sensitive exam, or they feel really nervous prior to performing this exam on a real patient.
The potential for this technology can just really open up a lot of doors for students to get more comfortable and confident in their procedural skills, in their interactions with patients. If you've had some practice in the virtual realm, then when you're with the patient, you can focus on them and their comfort. And I think that's what's really important and really exciting about technology like this.
The device which she wear is called as VR technology. The device which is in her hand, it is called as a remote. So in VR technology, she's looking the procedure, and with the help of remote, for example, she want to give IM injection or learn. So she is performing that procedure, that how to give IM injection. So she have to use the remote, right? So once she inserted the IM injection or administered IM injection successfully, so this will increase the confidence as well as the skills. So at the time of live administration of IM injection, she will not fail, right? Okay. This is the digital stethoscope. Next slide. The role of artificial intelligence and robotics in the nursing. Artificial intelligence is above the internet. Artificial intelligence and robotics are poised to revolutionize nursing care, offering new opportunity for efficacy, accuracy, and innovation. So this will reduce the error done by the human. AI powered tool can analyze vast amount of data, identify patterns and trends, and make prediction to support clinical decision making. As I explain you, if you want to see the last 15 days of the patient data, right? So before 10-15 years back, what we have to do? अरे चलो 15 दिन का doctors notes, nurses notes, input output, vital signs check करो. Then you have to make the comparison on paper. So with the help of artificial intelligence, what you have to do is you have to just give the filter on your website or system that I want to see the last 15 days ka vital signs. So it will compare and it will give you answer that what to do. For example, AI algorithm can help nurses predict which patient are at risk for complication, optimize medication and doses, and streamline administrative task. But automating routine process, AI free up nurses to focus on more complex critical aspect of patient care. So it will save your time also if you want to give more focus on complex signs and symptoms of the patient. Robotics also play a valuable role in nursing practice. Have you heard about robotics? How robot help us in clinical setting? Any idea? I'm not talking about robotic surgery. How robots helps you in clinical setting. So what we have to do is, if we want to give any medication to n number, bed number of the patient, for example, bed number 1, at 1 p.m. you want to give paracetamol tablet. So what you have to do after prescribing by the doctors, you have to feed the data in your AI system. So robot will bring the medication to the patients, and the robot will send you the sense that 1 p.m. paracetamol, bed number 1. That's it. We will see. Next slide. In conclusion, the integration of digital tools and technologies in nursing is not just a trend, but fundamental shift that is shaping the future of healthcare. From electronic health record to artificial intelligence. So just 10 or 15 years back, we were writing manually. Then it comes to digitization. Now it comes to the artificial intelligence. Nothing you have to write. You need not type to the tablet. Once the patient come to you, you set the patient. Now you have tablet in your hand. Now you have to speak. I want to write the admission note. So you have to speak. The artificial intelligence will listen your voice and it record your data, whatever you want to feed. So from electronic health record to artificial intelligence, nurses are leveraging this advancement to deliver more efficient personalization and innovative care to the patient. By embracing these tools, nurses can enhance the patient experience, improve health outcomes, and drive positive changes in the field of nursing in the digital age. Can we? No, last slide. Copy it and put in YouTube. Let's see how the robots are work in the clinical setting. Now it is not available in India, but soon we will have.
You may meet Moxie and its twin, Moxie.
Its name is Moxie.
Brand new robots. The robots are here to help the nursing staff with simple yet time-consuming tasks.
Moxie delivers items from central issues, either that are too heavy or just don't fit in a normal system. So like IV pumps, Sani wipes, which are cleaning wipes, chair alarms, cushions for patients. She can go to the gift shop and pick up items that a patient may have purchased.
For nurses, requesting Moxie is as easy as making a phone call or sending a text.
You basically search Moxie and her name pops up. Moxie comes up and you just text.
Can you see? The nurse is having the mobile. What she is instructing to the Moxie? Who is Moxie? Moxie is a robot name. She is instructing to the Moxie that specimen for pickup in 3 and W. It is a number of word or something. What type of specimen is it? So the robot is asking, what type of specimen is it? So, okay, please continue. Now the nurse is responding.
Moxie
Quick
receives
response.
requests, the robot responds within 5 minutes with a status update and an estimated time of arrival.
We're tracking the turnaround times that Moxie takes to do a task, which is currently running less than 30 minutes, which is great.
Moxie is the product of Diligent Robotics and brought to Cedars-Sinai as a pilot program. Marshall says the staff loves it.
They're thrilled that turnaround times that Moxie takes to do a task, which is currently running less than
So the
30
Moxie
minutes.
has picked something here for the patient, right? As per instruction. Continue.
Is great.
Moxie is the product of Diligent Robotics and brought to Cedars-Sinai as a pilot program. Marshall says the staff loves it.
They're thrilled that Moxie shortens the time of delivery for things that they're waiting on, like infusion pumps. There's this sense of thrill that they're getting things quicker than they would before Moxie.
But Moxie is more than just a robot delivery system. Both robots have personality and people can engage with them. Moxie's
Hello,
eyes
Moxie.
smile with hearts and the robotic arm waves hello.
I think that's one of the big positive benefits from Moxie is the staff get a little energy out of being around the robot, even our patients and families. I just the other day saw a picture of a child in the hospital playing peekaboo with Moxie. It has positive benefits that I wouldn't anticipate.
I think it's important to have Moxie be present at Cedars. I think it not only provides an opportunity to improve workflows and be more efficient, but I think it's a fun thing to see around the halls. Feels very future forward. It's that little connection, even though it's a robot, you still have that, you're my friend, you're my helper, let's work together.
One more video is there.
How many streams of income do you have?
Currently, I have two.
Currently two. How many streams of income?
Finally, tonight, what started as one nursing home's high-tech solution to staffing shortages has turned into an abundance of joy. Here's CBS's Omar Villafranca.
Hold it. Hold it. Hold it.
Jill Breckenridge has a
See, this is the scene of an old age home. There's one patient who's lost her memory. Now the robot is trying to revive her memory. Just think about a robot is trying to revive her memory. Start.
new friend at her Minnesota nursing home.
Hi, Pepper.
It's not a person.
It's great to see you.
It's Pepper, a special robot that can talk
I hope you are having a wonderful day.
and even dance with the residents to keep them active. But Pepper's special power is using new technology to bring up old memories.
Here is your brother holding your puppy.
Jill was diagnosed with Alzheimer's, but when Pepper shows her pictures of her past,
She's Alzheimer's patient.
the memories come flooding back.
I loved my horse. Lucky Strike warms my heart.
Sharon Fenn is Jill's daughter. She was smiling.
I know. I could tell from the back when I was watching her. She was beaming.
Arshia Khan with the University of Minnesota Duluth is the brain behind the robots. When you saw Jill with Pepper, what did you learn?
I was almost in tears. It was like that is what I wanted. We are taking them back in time. They have lost that time. It's gone, forgotten. But I'm able to bring that back to them, at least for a little while.
But you don't need a PhD to see the real benefits of a robot
Oh, thank you, Pepper. I like you too.
with a heart.
Bye-bye.
Omar Villafranca, CBS News, Roseville, Minnesota.
Nowadays, robotic nurse is under development. Soon we will have in our country also. Next slide. Next. See, if you have the system, so you have the challenge and opportunity. Let's see the challenge. In the past, past digital age we live in, the nursing profession face both opportunity and challenge. One of the biggest challenges is keeping up with the rapidly evolving technology landscape. So we need to update each and every time. As new technology are introduced in healthcare setting, nurses must constantly adapt and learn how to use them effectively in their practice. In 1990 or 1980, when calculator was there, people were counting money in hand, right? When calculator was launched, so people was fear कि हमारा जॉब चला जाएगा. जॉब गया क्या? Yes or no? It make easy our life. In 1991, when computer was launched in India, again accountant and people were thinking यार हमारा जॉब चला जाएगा. जॉब गया? In case job increase. So what about if artificial intelligence will be developing fully for nurses? If it is there, what will happen? What will happen? Job जाएगा, increase होगा. What do you think about? This is a question for you, right? So this is the biggest challenge. This can be daunting for some, especially those who may not have had much exposure to digital tools in their education or training. So need to update each and every time is the biggest challenge. Next, data privacy and security concern. Nowadays, it is more prone. When you open your mobile and you have a link, you open it, you got the lottery of 10 lakh rupees. Once you open the link, your money from bank is zero. It transferred to the other account and you don't have idea that where it is. So hackers will attack to the data in EHRMS of any hospital and they can get the data of patient and it disturb the privacy. With the increasing digitization of healthcare, data privacy and security concern have become paramount. Nurses are entrusted with sensitive patient information and it is essential that they understand how to protect this data from breaches and unauthorized access. Next slide. The opportunities also behind the challenges. Technology has the potential to revolutionize the way nurses deliver care, making processes more efficient and improving patient outcome. For example, EHRMS have streamlined documentation and communication among healthcare providers. So ultimately, the technology help the nurses, the medical professional to maintain the patient good health. Next slide. Next slide. Next. So in conclusion, the nursing field is undergoing a significant transformation from paper to internet, from internet to artificial intelligence. Significant transformation in digital age with the advancement of technology. Nurses are now equipped with tools and resources that enhance their ability to provide quality care to the patients. From electronic health record to telehealth services, the digital age has opened up opportunity for nurses to improve efficiency and accuracy in our work. However, amidst these changes, it is important for nurses to remember the core values of compassion, empathy, and ethical practice that define the nursing profession. So this is the question for us. If there is a artificial intelligence, the how to maintain the empathy and ethical practice while using the digitization as well as artificial intelligence. Thank you.
Thank you, sir, for sharing your valuable informations and knowledge among us. Your session was very effective, learningful. Hope all of you got better knowledge. Thank you. Thank you, sir.
I request Professor Dr. Lakshmi Priya Das to felicitate our speaker, Dr. Jayesh Jain sir, with a token of respect and gratitude. I invite Mrs. Seema Kokar to felicitate Professor Dr. Lakshmi Priya Das for moderating the session. Thank you so much, sir and ma'am.
Moving forward onto our next session, which is on futuristic trends in nursing research and nursing education. To continue with the session, I invite Mr. Dhruv Thakkar, Assistant Professor, Noble Nursing College, to lead the session by introducing the expert for the session, Professor Joy Gamadia, Principal at Narayan Sastri Institute of Nursing, Jetpur, Ahmedabad. Over to you, sir.
I would like to share brief introduction about Professor Joy Gamadia. Sir is working as a principal at Narayan Sastri Institute of Nursing, Jaitalpur, Ahmedabad. Sir has PhD scholar, Doctorate of Philosophy in Nursing Science at PP Sawan University. He has 15 years of teaching experience as well as clinical experience. He has published at various articles in national and international level. Sir has organized participated and resource person as a speaker, moderator in various workshop, webinar, and conference at state and international level. He is assessor and inspector of State Nursing Council and as an external examiner for post-graduation and undergraduation nursing student. I would like to invite Professor Joy Gamadia to give a brief knowledge regarding future nursing, future trends in nursing and nursing research.
Thank you so much. Good afternoon, you guys. I'm in a very difficult situation because like we are running very late and I know that it's a lunchtime, but I'm going to speak very crisp, very fast, and I hope that everybody will have a wonderful session. So quickly we'll start. So so first thing is my topic is future trends in nursing research and nursing education. So I want to start with the word trend. So what is trend? Okay, so trend is commonly used for fashion, right? What is in trend? What you wear, what you, how you have your hairstyle. Okay, but in professional life, when you go, the trend is a general development or change in a situation or in the way that people are behaving. And one more thing is a general direction. I want to take you there. So it's a direction. So trend means a way, a direction. Okay, we are going somewhere, and where we are going to reach, that we are going to reach for something developing. Okay, and one more word is common. Okay, so let me ask you, what is this? What is this? Projector. Okay, so it's a LCD projector. હું કોઈને પૂછું કે આજે કોણે પહેલી વખત એ વસ્તુ જોઈ? How many of you are there, those who are seen for the first time? You will laugh at me, right? So you will say કે સર તમારા કોલેજમાં નથી LCD projector, right? But somebody asked me this question 25 years back, this was the trend. Okay, now it is common. So today's trend is tomorrow's common. Yesterday's trend is today's common, right? So with this note, we are going to start. Okay, yeah, fine. So where to look for these trends? Okay, professionally, where you look for these trends? कौन बताएगा कि trends क्या है? Right? So there are certain organization. You can definitely look at the NSS, Nursing Scholar Society, for the upcoming trends. We are discussing that. Okay, NTI, and there are so many organizations, those who can guide you about trends. But there are authorized organization, those who are trend setters in the nursing field, and one of them is the Indian Nursing Council. Okay, so Indian Nursing Council is a trend setter that looks that what is upcoming, and for that it started changing their students, their faculties, their staff nurses. Okay, so yeah, so what INS is doing, because we are discussing about the nursing education, so about trends, first thing INS is doing is curriculum innovation. So you all know that we have a new syllabus, right? New BSc nursing syllabus. First, it was previously it was for yearly basis. Now we have a semester-based system, right? Okay. So there are some few changes are there which can tell us that on what direction or what things are trending. So first thing is mandatory modules with certificate. So INC has made it compulsory to go through with this mandatory modules. Okay. And every module you need to have a certification from either from your college or from an external body. Second thing is elective modules. There are some elective modules. You can choose that modules and you can work on it. Third thing is credit system. Okay. So what is credit system? So previously when students are getting passed out and then when they move to a foreign country, for their transcript and other things, the foreign country used to ask us as a principal that let us know that this particular subject is carrying how much credit, and we don't have the particular answer. But now in this syllabus, we have a very particular answer for each and every subjects. Okay, each and every theory classes, each and every practical classes, and each and every clinical hours. So we have a well-defined credit systems, and this is a trending one. Okay, now we are matching ourselves with the international standard. Now, next is the end semester college exam subjects. Please, next. So these are the mandatory modules. You all know, you can go and refer your syllabus. Next is elective module. Next slide. Next. Next. Yeah, so matching international standard. Next. So yes, about this credit. Now, Academic Bank of Credits, which called ABC. Okay, it was introduced in National Education Policy. And this ABC, Academic Bank of Credits, is an account. Every student should have this ABC account. How many of you are having ABC accounts? Just raise your hands. No one? Okay. So I'm giving you a takeaway that after finishing this conference, you'll go and open your ABC account. Okay. You can go and Google that how to open a ABC account, and you will find out that every credit you will achieve that will be credited into this ABC account. So this is the takeaway. Okay. Takeaway means when you go to a restaurant, you will have food, right? Whatever you can have. So right now you are in a restaurant, we are serving you food, you are eating it, but some things is left over, you have to take away to your home. So this is a homework. You go and open a ABC account. One more homework sir has given you. Open a ABHA card, right? So this ABC account, every your credits will be generated there. Next. Next. Yeah. So these are the end semester college exam subjects. So in previous syllabus, it was very less. I think only the English and one more subject was there. But in this syllabus, we have changed up to 4. So first thing is communicative English. Now even the language is being trending. Okay. It is not a simple language, simple English language, but INC is focusing on what? Communicative English. So the module like the TOEFL or what do we say, the IELTS modules are LSRW, right? And the INC module is LSRGW. G is for grammar. Okay. So you just go through with your syllabus. So this is the trending communicative English. Next is health and nursing informatics and technology. Sir has taken a nice session about technology. So I'm not going into deep, but this is trending in the nursing syllabus, nursing informatics. I believe that right now it is not a mandatory subject, but I think that after 5 or 6 years, it must be a compulsory university subjects, because many of you guys are, very far from the actual technology. You might be good with Facebook or Instagram or everything, but the technology which is actually required, you should be thorough with it. You are not, expert with that. So I think at least a practical exam of nursing informatics should be there. Then professionalism, ethics, professional values. And next is introduction of forensic nursing. So this is also a very good area coming up, forensic nursing and Indian law. Okay. For forensic nursing, I want to tell you that last month, our home minister was there in a college, and he was saying that new Nyay Sanhita is coming, right? The Indian penal codes are getting vanished, and Nyay Sanhita is coming. So in that acts out, like for every offense, now the police has to produce forensic evidences. Okay, so the forensic values are going to be high, and nurses will have another branch called forensic nursing. Next. So technology and nursing, again, the first session is all about that. Into that. Next. Yeah, so first thing is nursing informatics, which is in trending. Second thing is high tech, high touch approach. Next. Next. Yeah, so nursing informatics is, sir has already explained the EHRs, telehealth, decision support system. Okay, so decision support system is what? Decision support system is based on the data feed on the computer or the repeated data. Now on a computer will give you suggestions of decision. Okay, for a simple example, if I'll give you of decision support system is, let's say it based on AI. So I'll give an example. I'll go to my college at morning 9 o'clock. Okay, and I connect my mobile with my car, and I put into the Google map that the college address. Okay, so that is day one. And same time, like at 5 o'clock, I'll put my home address in the Google map. Right, second day, I'll do this again. 9 o'clock, college address, 5 o'clock, home address. Third day, same thing. When I do this repeatedly, the fourth day, Google Map will tell me sharp at 9 o'clock that you want to go to college or not. Right? So the suggestion of address, the first suggestion will be my college address. On 5 o'clock, the first suggestion will be my home address. How come this computer knows? It is having a data of last 3 days that this person is doing same work on the same time. The same thing, this is a very small example about decision support system. But if you apply this thing into the clinicals, so the machine or sorry, the computer will suggest you that if the pulse rate is this high or the ECG changes is this, then you have to go with this medications or this position or whatever the treatment lineup, right? So this is called decision support system. Next is data analytics. Data analytics is a complex system. Whatever data you are feeding into your system, it will analyze everything and give you kind of suggestions, right? Next. So a simple example of how informatics works. So this is a triangle like people, then computer science, that is software, and computer engineering, that is hardware. If you don't know what is hardware, so every physical structure of a computer, let's say memory, RAM, then your batteries and all the circuits, that's called hardware. The software is the application which you use, the website which you use, and the people is nothing but the data from where this software and hardware will get data. So if you change people into nurses, that becomes nursing informatics. Next. So high tech, high touch approach, this also you have to understand that despite we are saying again and again, use the technology, there is one thing that's called balancing technological advancement with human touch in patient care. So the core value that nurses are having right now is the care, right? And the touch and sympathy, empathy, personal touch, everything should be there. It cannot be replaced with the technologies, right? You can, I just forgot the name of that robot, but Moxie, yeah, Moxie. So Moxie can bring medication, but Moxie cannot go and do back care, right? It must be done with our hands and must be done with nurses. You know, Moxie cannot go and give health education, that the nurse will go and give the health education. So that's called high tech, high touch approach. Next. So simulation in nursing education. So I think that also been talked, but I want to tell you that what is simulations. It's a safe and controlled environment for the students to develop clinical skills, critical thinking, and decision making abilities. To make it very simple, I want to show you what the simulation lab look like. So this must be looking like a ICU setup, right? But this is not ICU setup. This is a simulation lab of one of the College of Nursing in Florida. So in every bed, if you see, there are high fidelity mannequins, and every mannequins work differently. Okay. So what is simulation basically? Simulation is a controlled environment where you are giving a certain situation. On based on that situation, you have to act. Now you have to differentiate that in the nursing foundation lab, you will do procedures, step by step procedures, right? OSCE also you will do the procedures, you have to show the steps. But in simulation, you don't have to only focus on the steps. It is about how you act in a certain situation. Okay. If emergency comes, how you are going to act, that you have to show in the simulation situation. Okay. So under the controlled simulation situation, the evaluators are going to observe is like how you act, how you perform, how you practice. Okay. It's not only about procedure and its steps. Next. So again, this is another picture of simulation lab. Next. So the key feature of the simulation. Next. Yeah, so risk-free opportunity to practice various clinical scenarios. So again, this is a clinical scenarios. Like the scenario must be like if you are receiving a burn stage 3 burn patient and now you have to act. So that kind of scenario must be given, and there's a risk-free. Why it is risk-free? Because you are not injecting any medication, anything on any patient, any live patient. You are doing everything on a high fidelity mannequin. So there is no harm to any life. So that's why it's a risk-free. Then mimic real life clinical situation means there is a situation being given, like it is like it has been explained to you a situation for certain minutes that this is a situation, and then you have to work. And high fidelity mannequin is one of the key feature. Then what do you call high fidelity mannequin? So this mannequins are not the simple ones which is there in your lab, but this mannequins are first of all it is expensive. Then second thing is it can give eye blinking, it can give heart sounds, bowel sounds, it can give you lung sounds, it can talk with you, like it can answer you back. Then many things you can, like the catheterization, even IV cannulization you can do on this. So these are very expensive one. Next. So technology in nursing education and research. Next. So yes, we all use this. Still, I'm considering this as a trend because it's keep on increasing. So first thing is easy search and accessibility of scholarly articles. So now, like when we used to study to find out a relevant study for our LOR, review of literature. So for that, we have to go to our library and find out in many of our journals, and we used to read which is not even relevant. And then after so much of reading, we'll find out one or two scholarly studies. But right now you are having a mobile on your hand, and if you just Google the keywords, okay, many studies you can find out. So this is a trending one. Then online journals, online database, online clinical guidance. So it is all about internet, using of internet for the research. Next. Advanced educational technology. So now again, I think how many of you are having smart boards in your class? Just raise your hand. Okay, so if still it is trend, so it is not common. So smart boards, we'll see that what is smart boards. Computer model, smartphone, tablets, and Android application. I'll show you what is smart board. So this is a called smart board. It's just like a huge TV, okay, a touch screen, which on that teacher can write as a green board, and you can edit the image, you can overwrite on the image, you can show the videos, you can pause the video and overwrite on that. You can keep one side a PDF and one side a PPT, and many more things you can do with this smart boards. So now the classes are becoming smart. This is the another thing that's called touchpad. And if the classes are online, then the teacher must have this kind of touchpad. So what is happening here? The teachers are writing on the touchpad, and it is reflecting on the shared screen. Okay, so this is in the trends. Next is you guys are like in a blessed environment when you have animation and cinematic technology. Believe me, 25 30 years back when we used to study anatomy, we have a single black pen diagrams of, let's say, vertebrae, and we cannot make out that which vertebra it is. You know, when we go to the anatomy lab and see that actual vertebra, will come to know that okay, vertebra looks like this. Okay, but you guys are having such a great animations video, and on top of that, they are free. They are free on the YouTube. So now the concept is very easy to get cleared by looking at this animation videos. Okay, next. Okay, so next trending is a student population. Okay, so there are 4 photos. This is 1942 photo, this is 1960 something photo, this is recent photo of a foreign country, and this is our Indian student photo. So can anybody tell me what difference you are seeing here? Anyone? What difference you are seeing in all of these pictures? So despite of changing of uniform, you can see in this 2 pictures there are only females, but in this 2 pictures you can see there are the male students as well, right? So the times are changing. First, in the back of time, the nursing are considered as a female oriented profession, but right now the times are getting changed and more males are coming into the profession. So trending is males are also coming into the profession. Next. Okay, so clinical teaching learning process. So we are now focusing on the evidence-based practice. So any practice are based on research. Okay, so now even you guys are having a habit to check that whether the whatever the being spoken is true or not by checking on the internet. But even our textbooks are quoting so many of research studies. So we are focusing on evidence-based practice, the research data. Next is yes, next. Next is evidence-based practice. Next. Advanced clinical nursing education. Okay, so this is the list of post-basic diploma courses, and I didn't make it by myself. The Indian Nursing Council is running these courses. So this is a courses to advance your clinical education. Okay, and they are offered by Indian Nursing Councils. Next. Then one more thing is clinical instruction for training the trainers. Now trainers is like what? That your teachers. Okay. So again, the INCS set up a very high class simulation lab in Gurgaon and SGT University with the help of Jepaigo and many more players. So what they are doing is they are calling your teachers and they are training your teachers to get a good quality simulation knowledge for 7 days, right? So again, the trending is training the trainers for upcoming time. Next. So knowledge expansion. So expanded nursing literature. Again, I have told you like previously to find out any of the nursing literature research study, it is very difficult, but now it is on your tip of your fingertip, right? Next. And last thing is mode of education. So e-learning and online education, interprofessional education. So e-learning right now, you are sitting here. Some of them are, attending this same conference in Zoom, right? So that's kind of e-learning is very common nowadays. And online education, interprofessional education, right? So two professionals are exchanging their body of knowledge, that is also in the trends. So these are the trends we can find out for, let's say, upcoming 10 years for the nursing education and nursing research. Okay. So where to look for the trends? So the bodies which are responsible for getting you into the trends is one of the body called Indian Nursing Council, Gujarat Nursing Council, and many more, which can sense the changes and it can inculcate in your life through syllabus expansion, through new clinical technologies and new clinical education. Okay. So anybody has any doubt? Anyone? Okay. Thank you so much.
Thank you so much, Professor Joy Gamadia, sir, for giving knowledge regarding future trends in nursing education and nursing research.
I request Mr. Dhruv Thakkar sir to felicitate our speaker of the session with token of gratitude and respect. I invite Ms. Priyanka Patel to felicitate Mr. Dhruv Thakkar with memento for moderating the session.
Okay, so now is the time you are all awaiting for. It's a lunch break for half an hour. Feeling relaxed. Okay. So for all the delegates who have come, all the students, your lunch arrangements is on the first floor. The students will guide you in the hostel area. And for the guest, we have arranged on the first floor. I request all the student volunteers kindly assist everyone to the respected area. I request all the participants who are attending online, we will be joining in half an hour, exactly half an hour. I request all the delegates to report to the auditorium by 2:15. Thank you.